Elderwerks Educational Services is a not-for-profit 501c3 organization providing senior living coordination, advocacy, and education to. In many instances, our consultants serve as a lifeline or personal confidant to older adults who literally have no one living nearby. Elderwerks prefers senior housing options and providers based on you and your needs. What did you used to do? What do you do now? And what do you want to continue doing? We provide complimentary referral services to vetted supportive care providers and help families and acquaintances secure personalized living and benefit information. Our consultants are experts in senior housing of all types. We have toured the senior communities in Illinois, documenting the services, amenities, and quality of care to ensure seniors transition to the best options based on their individual. People view aging much differently than those of previous generations. Our seniors want to be connected, relevant, and celebrate life in active, vibrant surroundings. We've helped thousands of clients secure and maintain a quality of life that suits their personalities. As the population ages and demand for senior services increases, Elderwerks will be there, offering more learning opportunities, activities, fun, and support. Aging well and planning for future needs can be easy if you call Elderwerks 847-462-0885. Vicki Madigan is an insurance broker at Madigan Insurance Group. She'll be discussing Medicare Made Clear, where you'll learn the basics of Medicare Parts A, B, and C. Please welcome Vicki Madigan.
Hi, good morning. My name is Vicki Madigan. I'm working at Madigan Insurance Group in Huntley, Illinois. We are a local agency specializing in Medicare products. However, we have licensing for Medicare products in many other states because we know that once you retire, you move. So nationwide, we do have quite a few licensing in other states for Medicare products. Today, what I'm going to share with you is information about Medicare. So go ahead and grab your favorite beverage, and we're just going to go ahead and get started. We will be taking questions at the end of today's presentation. So today we're going to learn the basics of Medicare, and there are several parts of Medicare, A, B, C, and D, and we're going to hopefully help you understand your Medicare choices better. So this is our agenda. What is Medicare? Who is eligible for Medicare? What are your coverage options? When can you enroll? What are the next steps that you take? And where can you find more information? So to be eligible for Medicare, first of all, you need to be a U.S. citizen or a legal resident for at least 5 consecutive years. And you need to be 65 years or older. If you are younger than age 65, you can qualify with a specific disability, such as end-stage renal disease, which is kidney disease, or ALS. Your coverage options are Medicare Part A, Medicare Part B, Medicare Part C, Medicare Part D, and Medicare supplements, sometimes referred to as Medigap plans. This is a chart that's in the Medicare and You book. It shows you how to decide to get your Medicare coverage. The card on the upper left of the diagram is the original Medicare health insurance card. You need this card before you can enroll in either a Medicare Part D plan, a Medicare Part C Medicare Advantage plan, or a Medicare supplement. Think of your original Medicare health card as keys to the car. If I bought you a brand new car and parked it in your driveway, but didn't give you the keys, you could not go anywhere. So the very first thing that you need to do is you need to apply for this Medicare health insurance card. At the end of the presentation, there's a slide with the Social Security website on it where you can apply online. As of today, many of the Social Security offices are still closed, so your best bet is to go online to the Social Security website and apply for Medicare. Once you get this card, we can then help you enroll in a Medicare Part D drug plan, a Medicare supplement insurance or Medigap policy, or a Medicare Advantage Part C plan. Let's look at some definitions. A premium is the amount you pay to have the plan, the monthly cost. So premiums apply to Medicare Part D plans, Medicare Part C plans, Medicare supplements, and Medicare Part A and B of original Medicare. The deductible also applies to all of those same things. It is the amount you must pay for your health care or your prescriptions before your plan or original Medicare starts contributing to the cost. Now, most people get copay and they get coinsurance confused. So let me try to help you understand that a little bit better. A copay is always a dollar amount, like $5, $10, $20, like you might pay a $20 copay to a physician. A coinsurance is always a percentage. Original Medicare has a 20% coinsurance for Part A and B for consumer sharing. So again, coinsurance is always a percentage, copay is a dollar amount. Let's talk about the Part B premium. The Part B premium of original Medicare, that's the red, white, and blue card, is either deducted from your Social Security check prior to it being deposited into your bank account. And if you are not receiving Social Security income at this time, you will have to mail your quarterly payment to Social Security. So once you start receiving money from Social Security, again, before they give you your money, they're going to take out your Medicare Part B as in boy premium. This year, the standard Part B premium for 2021 was $148.50 per person. We also get a lot of calls at our agency about something called IRMA. IRMA is income-related monthly adjustment penalty, and it is applied to either your Part B premium or your Part D drug plan premium when you make too much money. There's a table and a chart on the Social Security website to let you know the dollar amounts that would apply before you get the penalty. Now, what they're looking at is your MAGI, which is Modified Adjusted Gross Income from 2 years ago. So in 2021, if you're turning 65 right now in August, then they're looking back to 2019, they're looking at your tax return, and they're looking for a certain dollar amount to see if you need to have that penalty. As your income reduces, the penalty can go away. So let's talk about the parts of Medicare, because a lot of people get very confused with all these alphabetical letters. So Medicare Part A, think of the A as admitted. It's a status. When you go to a hospital or a doctor's office, you have a status. You're outpatient, you're inpatient, or you're in observation. And hospital insurance, Medicare Part A of your red, white, and blue original Medicare card pays for 5 things: inpatient hospital care, inpatient mental health care, skilled nursing services, hospice care, and some of your blood transfusions. So if you're looking at the little picture, you'll see it's a bed with an A, means you're not going anywhere, you're in bed, you're pretty sick, you're admitted, your status is admitted. Now let's talk about outpatient, doctor and outpatient visits. That means you get up and you can go home. You're not staying in a hospital. So these are your outpatient doctor appointments. Any services you might receive at a hospital, but they're outpatient, like a lab or an x-ray, an ambulance ride, an outpatient mental health session, whether that's individual or group, laboratory services, DME, which is durable medical equipment, like a wheelchair, oxygen, crutches, any outpatient physical occupation, speech language therapy, and some of your preventative care. Remember that Medicare gives you 23 no-charge preventative services. Now, what's not listed here that confuses people is the emergency room. A lot of people think, well, I got taken to a hospital. I'm in the hospital even though I'm in the emergency room. When you're in the emergency room, your status is outpatient. So Medicare Part B is what's paying for your outpatient. The other thing under Medicare Part B not listed is the observation status. And you will learn that if you have an observation status and then need to go to a skilled nursing facility, which is paid under Part A of Medicare, it is required for you to have a 3-day inpatient admitted status before you move to a skilled nursing facility. If that doesn't happen, Medicare denies your claim. Very important to know your status. So what does Medicare not cover? We're talking about original Medicare, red, white, and blue card, Medicare Part A and Part B. So those deductibles, co-insurances, and premiums that we talked about earlier are not covered. Something called a Medicare Part B excess charge. So Medicare gets billed a certain sum of money. They approve a lesser sum of money. What's in the middle is called an excess charge. Prescription drug coverage. That's why we have a separate standalone Part D plan. Any additional benefits such as hearing, vision, and dental are not covered by original Medicare. If you are a person that is in long-term care or in custodial care, if that is the only care you need, so there's no medical care happening, most nursing home care long-term is called custodial care and not covered by Medicare. So let's talk about the 2021 deductibles and co-insurance. We will be getting the 2022 information after open enrollment begins October 1st of 2021. But for this year, the Medicare deductible for Medicare Part A is $1,484. Now, this is not an annual deductible. This is a benefit period deductible, which I will give you that definition in a minute. But what you need to know is if you are admitted to a Part A facility during a calendar year, that deductible can be applied to you again. Then you're also responsible for 20% coinsurance of all Medicare approved costs. Medicare Part B, that's your outpatient, will give you a deductible one time a year of $203 for 2021. This deductible will increase for 2022. And again, I hope to have those numbers in early October. You are also responsible for all Part B outpatient 20% co-insurance of all approved Medicare costs. Now in red, I have no maximum out-of-pocket on original Medicare. And you might not know what out-of-pocket maximum means. So it means, let's say you have a very expensive medical bill of $100,000 or $200,000 that's yours to pay, and then you become ill again, and then you get another $100,000 or $200,000 of medical bills to pay. It just keeps adding on. I like to use the term it snowballs, because there is no limit, no ceiling where Medicare pays at 100%. Let's talk about that Medicare benefit period definition. So let's read this. A benefit period is the way the original Medicare program measures your use of inpatient hospital and skilled nursing facility, abbreviated SNF, services. It begins the day that you enter a hospital or a SNF and ends when you have not received inpatient hospital or Medicare covered skills in an SNF for 60 days in a row. So if you go into a hospital or a skilled nursing facility on January 1 and you leave on January 30th, on February 1st, they start counting forward 60 days. If any time in that 60-day period you get hospitalized, you've paid that one time. You go in January 1, you get out January 30th. Now you have 60 days. During that 60-day period, no new deductible. On day 61, you get a new deductible. So if you're good at math, you can take a calendar year of 365 days. You can divide that by 60 days, and you can see that it's almost 7 times in a calendar year if you were hospitalized every benefit period, that $1,484 could be multiplied by 7, and you would have had a very costly year in Medicare Part A deductible. Okay, standardized Medicare supplement insurance plans, also known as a Medigap policy. So Medicare supplement plans or Medigaps, what is their purpose? What do they do? So those co-insurances, those deductibles, any out-of-pocket cost other than a premium, a Medicare supplement plan will cover. They are federally regulated. They are offered by private insurance companies. There are plan letters A to N, and I need to talk to you for a second right here. I'm going to pause and talk about Medicare Plan F. So if you are a Medicare beneficiary and you have Medicare Part A and B dates on your original Medicare card that are before January 1 of 2020, you may purchase Medicare Supplement Plan F. If the date on your Medicare card, Part A and B, is January 1, 2021 or later, you are not eligible due to the macro law to purchase a Plan F. Your most coverage of benefits then would be Medicare Supplement Plan G. In my agency, we see a lot of Medicare Plan G. We see some Medicare Plan N. And how do we decide that? We sit down with you individually, whether that's over the telephone or in an in-person meeting, to see what financially meets your needs the best. So one thing that a lot of people don't know about Medicare supplement plans and the federal regulation is that every major insurance company and carrier that is qualified through CMS to offer a Medicare supplement plan has to follow all the same rules. So this is one time branding by a particular name of a company is not most important. In choosing a Medicare supplement plan, You want to find the plan letter name that's the most comprehensive for you and your budget. Then you want to look at the lowest cost of premium. And then we have a tool in our office that helps us kind of do a market analysis, which will allow us to see how is your premium going to increase over the next 5 years. So then you would pick whichever Medicare supplement plan is most appropriate for you. Again, generally, the more coverage, the higher the cost per month. So one of the things I get asked all the time is, is it a locked-in premium? So let's just say today I do a quote for you and your premium is $110. It will be secure for $110 for the next 12 months. However, on your birthday or a year from the date you enroll, your private insurance carrier that holds your Medicare supplement will send you a premium increase letter. Sometimes it's a few dollars, sometimes it's more. You do have the ability to change your Medicare supplement every month of the year because Medicare sees supplements as an insurance product. So that allows you to have enrollment opportunities January through December. Medicare supplements are not subject to the October 15th to December 7th open enrollment period. So again, the more comprehensive your coverage, the higher your premium. If you're watching this video and you live in the great states of Wisconsin, Minnesota, or Massachusetts, I have to give you some other information because those plans work totally different. And we are also licensed in Wisconsin as an agency. This is the chart that you can find in the Medicare and You book in the 2021 plan year. This is page 72. Under the word benefits, all of those boxes show you the category, like a Part A deductible or a coinsurance. Then as you go across from left to right, you have your plan letters, A to N. And then let's just take the first box, Medicare Part A, coinsurance and hospital costs, up to an additional 365 days after Medicare benefits are used. You can see all of the plans, A to N, pay that at 100%. If you look under Plan A, you'll see when it comes to skilled nursing facility care and coinsurance from Medicare Supplement Plan A, the box is empty. There is no number there. It means there is no coverage under Medicare Supplement Medigap Plan A. There is $0 coverage for skilled nursing facility care. The first plan that offers that at 50% is K, and then Plan L offers that at 75%. And then Plan G, which we do quite a bit of, offers 100% coverage in a skilled nursing facility. So what do you have to do to be eligible to get a Medicare supplement? Well, the very first thing is you need to get that red, white, and blue original Medicare card and be enrolled in Medicare Part A and B. You then need to be a resident of the state in which you are applying for coverage. You need to be age 65 or older, or if you're under age 65, you need to have certain disabilities. And if you are a person who has a diagnosis of end-stage kidney disease, you may get a Medicare supplement plan. Now we're going to move to Medicare Part D. D is for drugs. We're going to look at drug plans. I get asked this question all the time. I don't take medications. Why am I looking at drug plans? Well, as you will see as I go through the slides, you will be assigned a late enrollment penalty, which we call an LEP, if you do not enroll in a Medicare Part D plan when you are first eligible. I will be repeating that again because a lot of times I get people say, I didn't know that. Now, am I really stuck? We'll say, Vicki, am I really stuck with this penalty for the rest of my life? And the answer is yes. And I don't like to be the messenger of that bad news. So Medicare Part D helps with the cost of prescription drugs. Again, offered through private insurance companies. Let's look at the fast facts. So prescription drug coverage varies from plan to plan. Catastrophic coverage protects you from very high drug cost. And the benefits of Medicare Part D plans do change each year. Your enrollment, each plan has a list of different drugs that it covers. That's called a formulary. So as an agency, we get a list of your medications. We look them up in some computer software we have, and we find the drug plan that covers all of your medications at the lowest cost. And yes, it's very important to make sure your drugs are covered before you enroll in a plan. You do not purchase a Medicare Part D plan simply on the cost of premium per month. The list of drugs that your particular drug plan covers can change from year to year. So every year at this end of September, if you're somebody watching this already on a Medicare drug plan, you will get a document from the company that you are insured with called an annual notice of change. It is a law that they send it to you at the end of September before the open enrollment in October, so that you can see if the medications you're currently taking are also going to be covered in the next plan year. Very important about coverage. It is not automatic. And like you will hear me say again, and I said earlier, penalties do apply if you enroll late. What is a formulary? So a formulary is how they price the list of drugs covered by your plan. These are called tiered formularies, and they go from numbers 1 to 5. And you can see by the graphic with the dollar signs that the lower the tier, the lower the copay cost out of pocket for you. The higher the tier, the greater the copay cost. Okay, so a tier 5 drug is much more expensive than a tier 1 drug. All right, we always get asked about the donut hole, okay? So in 2021, the donut hole is closing. I do a whole seminar on Part D, but what's really important for you to learn today is there is a process. The process remains the same year to year, and the costs change, the dollar amounts change, but how it works does not. So every year you will have a deductible. Okay? So this year it was $445. I believe I heard somewhere that it's going to go to $480 for 2022. Once you meet your deductible, and depending on what Medicare Part D plan you have, your deductible could be zero, your deductible could be the full amount for the given year. It depends what plan you're enrolled in. So once your deductible is met, and every consumer has the deductible to meet, you go to the initial coverage phase where you're paying a copay 25% of the covered retail cost. Then if you need a certain dollar amount, the government gives you so many dollars per year to help offset that initial coverage phase copays. When that is exhausted or your bank is at zero, that's what throws you into the donut hole or the coverage gap, where now you're getting no help from the plan, and you're paying 25% of the retail cost. Again, you have to meet a certain dollar limit, which changes every year. If you meet that before the end of the calendar year, then you move to the final stage, which is called catastrophic coverage, and you pay 5% for your prescriptions. So I get this question all the time, especially when it starts to hit like August to October. We'll get calls from clients that say, you enrolled me in this plan and now I'm in the donut hole and I want out of this plan and I want you to get me a plan where I'm not in the donut hole. So at that point, I cannot disenroll you from your drug plan unless you have a viable enrollment period. So let's just assume for our discussion, you do not have a viable enrollment period and you're in this plan and you hit the coverage gap. Most of the time, it is not your plan. It does not matter if you're in company A or company B or company C. It's driven by the medication. So you need to look at your medication list. You need to talk with your physician to see about the retail cost of your meds and what tiers your meds are in. Now, you may not be able to change. You may need those exact medications because that's what keeps you well. And so you're kind of stuck. You have to move through that coverage gap / donut hole. I just tell people, look at your medications. And if you're watching TV and you see them in a commercial, there's a really good chance you're going to hit the coverage gap. This slide is about the late enrollment penalty. That number 32 cents, the government now takes the average at 34 cents. They look at the number of months that you are not covered in a Part D plan, and they assess you this penalty. So in this example, this person's late enrollment penalty was $5.44. Not a huge amount of money. However, in the 11 years I've been doing Medicare, I have had people have penalties as high as $40 or $50 a month, and yet the premium on their drug plan might be $12. So we really want to help you avoid the penalty. If you have been putting off a drug plan, the sooner you get in one, your penalty calculation stops. So make sure you see us in the fall for that. Okay, now we're going to talk about Medicare Advantage plans, Part C. So Medicare Advantage plans can be healthcare plans only, or they can be Medicare Advantage plans with prescription drug coverage. There are many types of Medicare Advantage plans. The two most common are HMOs and PPOs. Okay, what do? They take all of the information off your original Medicare card, Medicare Part A and B card. They add secondary health insurance coverage and prescription drug coverage. They take all that information and they put it into one ID card. So you are now carrying your Medicare Advantage ID card in your wallet when you're enrolled in Medicare Advantage. You are not carrying your red, white, and blue card in your wallet. These Medicare Advantage prescription drug plans, again, are offered by private insurance companies. They give you some extra things that Medicare supplements do not, like routine vision care, hearing care, wellness services, over-the-counter products, fitness memberships, and nurse phone line support. How do you become eligible for a Medicare Advantage Part C plan? And you can see in the little diagram where it says Part C, it shows the hospital bed and the stethoscope, which is a visual indication to you that it includes your Medicare Part A and B. So again, you need the key to the card. You need the red, white, and blue original Medicare card, Medicare Part A and B. You must live in a planned service area. Your eligibility for Medicare Part C is not affected by health or your financial status, and this must not have end-stage renal disease was a rule for 2020. For 2021, that rule got lifted. So even if you have end-stage renal disease in 2021 and beyond, you can still enroll in a Medicare Part C plan. Now let me go back to the definition in bullet point number 2. You must live in a planned service area. You're like, what's a service area? So wherever you live, I live in Huntley, Illinois. I happen to live in McHenry County. So if I was enrolling in a Medicare Part C plan, I would have to be enrolling in a plan that services McHenry County. Now that doesn't mean I can't go see a doctor in Rockford or at City of Chicago or Lombard or wherever I might want to go, but my contract for my enrollment must be offered in the county in which I live. So it's very easy to substitute service area for county. Now, if you move out of that county, can you get another Medicare Advantage plan? Yes, you just need to redo your paperwork so that you're in that plan's service area. So plans and premiums can change from year to year. Again, you're paying the Medicare Part B monthly premium, meaning you're writing a check to Social Security for the Part B, or it's coming out of your Social Security check before money is deposited into your account. Here's the convenience of one single plan and one ID card. Many plans include prescription drug coverage. When it says coverage is often limited to a service area unless it's an emergency, that mostly applies to HMOs. And being required to see doctors and hospitals that are included in the plan's network is HMOs and PPOs, because if you're in a PPO plan, you can see doctors out of the network, you just pay a higher cost. So HMOs will require you to have a referral and to see required doctors and hospitals in the plan's network. Medicare Advantage plans with a PPO give you coverage in many different places, so you can go outside of the network. If you're in the network, you pay the lowest cost. Most, I'm going to use the word most, Medicare Part C Advantage plans offer additional benefits not covered by original Medicare, like dental, vision, hearing, preventative care, things like fitness memberships, and over-the-counter benefits. On this slide, we show all of the different types of Medicare Advantage plans. Again, Medicare Advantage plans are managed care plans, such as HMOs, PPOs, special needs plans, HMO point of service plans, private fee-for-service plans, and medical savings accounts. Very important topic, when do you enroll? So right now in August, the next open enrollment, or it's called our annual enrollment period, AEP. So when my life gets really busy, and your life gets really busy, your mailbox gets full, your phone rings a lot, and you see a lot of TV commercials. So the annual enrollment period is October 15th to December 7th. It is the same period of time every calendar year. What can you do? If you're turning 65, November, December, or January, you can enroll for the first time. If you're currently on a Medicare plan, you can switch plans. And remember the AEP, what does it apply to? Medicare Part D plans, drug plans, standalone drug plans, and Medicare Advantage plans. When does your plan go effective? So you come to our office, you visit with us, you make a decision to change your plan. If you're changing a drug plan or a Medicare Advantage plan, the changes that you make with us don't occur till January 1. Let's talk about initial enrollment period. Initial enrollment period is when you first become eligible. So take where the number 65 is. You're now 63, 64 watching this. Put your birthday month in there. Let's say your birthday month is May. So then you're going to subtract 3. You're going to go back to February. So the very first month that you can enroll in a Medicare plan will be February, then March, then April. Excuse me. Then on your 65th birthday in May, then June, then July, then August. Whatever plan you're in on September 1st on that month, that's where you will stay, especially if it's a drug plan or a Medicare Advantage plan, to the next annual enrollment period. We call this the 313 window. 3 months before your birthday, the month of your birthday, and 3 months after your birthday. All Medicare plans begin on the 1st of the month. So people will call me and say, my birthday is May 20th. They're thinking that their coverage doesn't start till May 20th. Actually, their coverage starts May 1st. Let's talk about different types of special enrollment periods. This is when you can enroll or switch plans due to special circumstances outside of your IEP or an AEP. This could have to do with moving. You geographically move from one plan service area to another. So you move from Illinois to Wisconsin. Or if you're on a Medicare Advantage plan, you move from Cook County to Peoria County. That would require a plan change. Or you move from home to an institutionalized setting. Or you're working past age 65 and you've become unemployed, either downsized or you choose to retire. You have a special election period into Medicare for that reason. Again, everybody's Medicare is a little bit different. It's very personalized. While we take it very serious at our agency to offer you really good education and help you to make the best choice possible as to what's right for you. So I told you that I would show you these next steps, which are what do you do first? So here's a common myth. Most of you have worked your life and you work for your company. And if sometime in your career you change jobs, you know, you left company A and then you went to company B, and 30, 60, or 90 days later, boom, you had insurance. So we're kind of conditioned to think that Medicare would probably work the same way, but it does not. And Medicare actually starts at your Social Security office, which unfortunately, due to the pandemic, you can't go to. So you need to get hold of a computer or find a family member that has an electronic device that can help you go to this website, which is www.ssa.gov. Now, when you go there, there is a blue bar. There is the word menu. You click on menu. then all the benefits show up, and then you find the word Medicare, you click on Medicare, and another new page opens, and you scroll down that page about 2/3 of the way. There you will see a big blue button that says apply for Medicare Part A and B. And yes, you want to apply for both Medicare Part A and B. Once you work through that application, it will be a few weeks, and then Medicare/Social Security, actually the letters coming from Social Security, will send you a letter telling you that you applied for Medicare, this is your ID number, and this is when your Medicare card goes active. A little bit later, you'll get another piece of mail from Social Security, which will be that original red, white, blue Medicare card. Once you receive the letter, you can contact our office and we can help you make a good choice for your secondary coverage for Medicare products, whether that be a Medicare supplement and a drug plan or a Medicare Advantage plan. And you can always add dental, vision, and hearing plans if you want to. Okay, every year, I'm really big on education. I want you to review the enrollment period. It's really important that you enroll at the right time. We need to do research, check your meds, look at your providers, make sure you're in the right plan. Ask questions, we'll give you answers. There are many programs. If you need financial help, if you're eligible, we'll help you do that. We can help you enroll. And each year you will get documents from us and a reminder to do your yearly review. Where can you find more information? This is our agency, Madigan Insurance Group. We're located in Huntley. There's my email, Vicki@madiganins.com. And we also have a great website that's full of information. If you want to review this Medicare information, we actually have a short video, 8 minutes, under our Medicare tab, which explains all the parts of Medicare again. And we also have resources. Well, thank you very much for joining me today. I think Elderwerks is now going to give us time for you to ask some questions. Please call us at 847-457-1802 if we can help you with your Medicare.
Hello, Vicki.
Hey, how are you doing this morning?
Good. Glad to see you have power.
Oh, yes. It was kind of dicey last night. I lost power 4 times.
Oh, gosh, yes. It was crazy. Around us, most of Cori is out of power. I've got power, thank God, because I melt easily.
Come to my house if you lose it. I got some AC.
Yeah, exactly. Just for everybody watching, the Palatine Center is open today. So if you don't have power, please come here, cool down, get some water, and enjoy our Wi-Fi, because we don't want any of our seniors to be sick today because of the heat. It's a bad, sweaty, hot day.
And they say we're getting some more storms tonight, correct?
Yes, we're getting more storms tonight, so be safe out there. Elderworks is here for you if you need anything. If you have emergency, call 911, not Elderworks, but we are here for you.
Right.
In regards to your presentation, I don't see any questions, but I always have questions because inquiring minds want to know. This is just who I am. So I know you were talking about Social Security, and there have been some delays. I've heard this previously as well. Have you found that people are having problems getting through to the Social Security Administration and getting response, or how's things been with you?
So here's what we're seeing. So as you know, I'm going to be in my 12th year come February doing this full time. And normally we tell people, okay, so I'll just say we have a person in Palatine, 67 years old. They're still working. They have great employer benefits. They maybe have a younger wife or some dependents, and they need to keep that person on that employer group health plan. So we would tell them you only needed Medicare Part A.
Okay.
That's what we've been saying all these years. So probably in the last 18 months, I have seen more people over age 65 for whatever reason, due to the pandemic, due to businesses closing, due to finances, whatever. They're working one day, they get a note, they come into work the next day, they don't have a job. Many employer group health plans, your insurance ends at midnight of the day you're terminated. Some other companies give you till the 30th or 31st of the month.
Terrible.
But if you are that consumer where you're over age 65 and you said, no, I don't want Part B, you're stuck.
You're stuck?
You're stuck. You cannot enroll in Medicare. You have to start the whole process of getting Part B at the Social Security office. Next problem, they're not open.
Right.
So then we have to do everything online. But however, there's some actual paper documents that need to be filled out by the former employer showing you had creditable coverage so that you get the special election period indicated in my slideshow.
Right.
And I actually had one guy last August who lost his job on like the 10th of August, and I could not get him coverage till October. He went without any health insurance other than Medicare Part A.
Oh my. So
what I'm telling people, given the light of our world and our situation and the fact that not only is Social Security offices are closed, we hear on the news every night, IDES is closed. Standard amount of money for Part B premium right now is $148.50. It's worth paying to me. It's worth paying that extra $148.50 while you're working, while you've got coverage. So if tomorrow or the next day you lose coverage, you have the ability to enroll in a Medicare plan for the first of the next month. Now, next question I get with that, Jennifer. Well, aren't I entitled to COBRA? Yes, you are entitled to COBRA.
Right.
That's a law, or in Illinois continuation law. However, Medicare says if you're over 65 and you take COBRA without having Part B, then they're going to penalize you a percentage for the rest of your life. So do you take the risk and get COBRA knowing you're going to have a penalty for the rest of your life?
That makes no sense.
Or do you take Part B now and pay the $148.50 up front so that if you do lose your job, you have coverage? And probably until the last year or two, I've maybe had that conversation 3 times in my insurance career. This year, I've had it over 7 times. I've had people, the longest person was 4 months before we could get coverage. The other thing that we're finding with people that are Medicare eligible is if they immigrated to our country and have legal immigration papers, because you can't go to a Social Security office and prove your citizenship, they want you to mail your original copy of your immigration papers. Now, nobody wants to do that.
No.
So it's just very, very difficult, very hard to do.
So,
I caught myself. I need to make one little quick correction. Plan F, eligibility for Plan F of Medicare supplements. Your Medicare Part A and B dates need to read before January 1 of 2020. I accidentally said 21. So the macro law says anybody who's got a Medicare Part A and B before January 1 of 2020 will always be entitled to Plan F of Medicare supplements.
Okay. So I was going to ask you about COBRA. So basically, because you're trying to make sure you have coverage and you get COBRA, the Social Security Administration basically penalizes you for the rest of your life.
Correct. Well, it's actually Medicare at that point, but yes.
That makes no sense because you're trying to do what's right for your family.
Right. So what happens is you're working past 65. You did not take Part B. You pretty much backed yourself into a corner. You either go with COBRA and get a penalty, or you go without coverage and you wait for B to get in place. Now, here's the other thing. If B does not get in place in the next 63 days from the date of your termination, you also have a late enrollment penalty.
So basically get on it is what you're saying. Don't delay and don't and basically always get Part B no matter what.
I never used to say that, but right now I am. Anybody that's coming to our offices to get education because they're getting ready to turn 65. And I want to just clear something. You can work till you're 100 if you want, if your employer lets you.
Right.
Just make sure you do what's needed at Medicare/Social Security and get Medicare Part A and B. So even if you go to work for ABC company and you've been on their health plan the 40 years you've worked there and you want to continue to work, you keep working there. You just don't need to take their insurance. Excuse me, it's probably more expensive than what you can get in Medicare, and you can get equally good coverage on Medicare. keep working, keep earning your money, just get on Medicare so that in the event that company closes or you get laid off or
You're covered.
You've got a way to get insurance. Think how terrible it would be if you were 70 years old and got whatever illness or injury and could not go back to work. And you needed to wait 6, 8, 10 weeks to get Medicare Part B before you could get health insurance.
You could be bankrupt.
You could be bankrupt.
That's
so we've kind of changed our tune around here a little bit from what we've seen and tell people, okay, you're working. Yes, it's going to cost you $148.50. Just pay the standard amount. Now, here's where I got to tell you about one more thing. Have you heard of IRMA?
Is it a hurricane?
IRMA is income related monthly adjustment.
Okay.
And that's based on your income. That's kind of one of the reasons some people don't take Part B. So like if you make a certain dollar amount over a threshold that Social Security and the IRS deem. So for example, a married couple right now, it's around $186,000 modified adjusted gross income.
Right.
They hit you with this IRMA penalty, income related monthly adjustment penalty, and you're paying a whole lot more money, which was why many people kind of waited to get Part B. I have a handful of people that are in that scenario, and I understand why they're not taking Part B, because the dollar amounts are $300, $400, $500 per month.
Right.
And so they're kind of just rolling the dice and taking the risk that they're not going to lose the job. And IRMA stays with you 2 years. That income related monthly adjustment goes back. It's calendar year. I get asked that all the time. It is calendar year. So if you're in an IRMA penalty now and you're hearing this, your penalty for 2021 was based on what your income taxes said for 2019. If in 2020 your income is a lot less, IRMA will go away. One other quick thing, if I can add, I had somebody one time was not getting IRMA penalty. This was a number of years ago. This person decided to take a large sum of money out of a 401k. That counts as income.
Yes, it does.
And it put this client $2,000 over the threshold. They had a very nice cruise and brand new floors in their house, but they had an IRMA penalty of $54 for 24 months.
So basically, know your numbers, because
Yes.
if you do want to take that extra income, go lower than the threshold, right? Go to like 180.
Right.
Okay.
Jennifer, can you see the questions? I'm not seeing
I
the
do.
questions.
There is one question. It says, I'm going to post it. Does the amount of money made each year change when computing the Part B $148.50 extra per month?
So the standard, there's always a standard amount. The standard amount goes up. So the standard amount for 140 is $148.50. Okay. Then every year they change that. They change the threshold. So for example, I believe an individual for 2021 can make around $80,000, like an individual single person. And I said the married couple was around $186,000. So if you go over that money amount, on your modified adjusted gross income of your income tax, you will have that IRMA penalty. So and I'm not sure if they're asking me in the question, does the amount of money made each year change?
So I think they're asking about that threshold, the amount of income.
Yes, the threshold changes every year. It goes up. So a year or so ago, it was like for a single person, excuse me, was like $76,000, and now it's like $88,000. So it goes up a little bit, not a lot.
Okay.
And then, I just tell people, talk with your financial planner person. I am not that expert. I am not your tax person, but you need to figure out income from an employer, income from Social Security, income from a 401k, income from a pension, income from an annuity. If it can ever be added as income, if your tax person says, yes, this qualifies as income, then you have to calculate that.
So basically, talk to your financial advisor or your accountant before, you do anything risky with your money. So if
Right.
you want to take more or whatever.
Right. So I'm sure the person that got that penalty for the 2 years that was my client never thought that by taking money out so she could go remodel her house or go take a cruise with her friends was going to cost her in a Medicare penalty for Part B for 2 years.
It's a hard learning experience.
Yes. They don't care. You don't know.
No. And then if you're still working and you are on your employer's insurance and you get the Medicare Part A and B, what's precedent? What do you use first when you're going to the doctor per se?
Okay, so that depends. How does that depend? So go to the Social Security website. I'm going to tell you two things. Go to the Social Security website. There is a document called Who Pays First. So let's take Elderwerks. If I worked for Elderwerks and I'm on Medicare, okay, Medicare is going to pay first. Elderwerks insurance is going to pay second because you're not a large employer.
Right.
If you have a federal employee health benefit or you have some other kind of benefit from a large entity, many times that is your primary insurance and Medicare pays second. There's no way for me as an agent to know that. That's really a conversation you need to have so each individual has that conversation with their human resources benefits manager.
Excellent.
They would be able to know who pays first, who pays
Maybe, because we don't know here. We haven't got insurance yet. We're probably going to try to get, I shouldn't even say this out loud. In the next year or two, we're going to try to fund that, but we're not for profit. So money's always an issue here.
All right. I'll help you with that.
Yeah, you will. Yeah, you will. Good news. We have a few people on Medicare here because we don't discriminate on age. We don't care. All right. I don't see any more questions. Is there any final thoughts you want to put out there to the world, Vicki?
If you have a loved one that is Medicare age and they do not have an electronic device or don't have internet in their home, and we run into a situation of being unable to meet in person, as we have last year, like many other things, it will be very difficult for people to either change plans or, if they can't come in and see me where I can do the electronic enrollment for them, they need to have some kind of an electronic device. So if you haven't learned that, and I'm just going to give a shout out, Jennifer, to your Emily at Elderwerks and all the people that I had to enlist and help to get my virtual booth up. Thank you to HyperX Media for helping me with that. And I had to go get resources. I tell everybody I'm a technology immigrant, but I had to learn to use it. And it's just where we are. And so to make your life easier, you should just learn some basics and get some electronic devices. But we have a complete staff. We're in multiple states. If you're just more comfortable with the phone, we can talk to you over the phone. But the thing is basically get a Medicare checkup. There's no cost or obligation to do that, so that you know that you're enrolling at the right time. You have your ducks in a row. So if you lose a job, you can get insurance and you're not stuck.
Yeah, that's true. Well, Vicki, here at Elderwerks, we do refer to you often.
Yes,
we have only a handful of agents we refer to and trust because, we're very picky here. We want to make sure our seniors get questions answered first and then business is second, right?
Right.
So,
yeah, you never have to worry. We always do what's right.
We know
what's right for the people.
We have sent people to you to answer questions. They've not purchased insurance from you. Their friends have. It's important that people feel comfortable with their agent. Their agent should never be pushing a product. Their agent should be finding a product based on them, on their whole person. So Vicki, you're a rock star in Elderwerks world, and we appreciate you being here today. Thank you so much.
Thank you for having me. Thank you so much.
No problem. You take care of yourself.
All right. Bye-bye.
Bye.
to Horizon Benefit Services, where we believe the key to health insurance happiness is both choosing the right insurance plan and knowing how to use it. That's where our care makes all the difference. We help you select the best plan at the best cost and provide outstanding customer service. Whether you're an employer looking to offer benefits to your employees or you need help planning your healthcare costs in retirement, you've come to the right place. We help you achieve health insurance happiness through our unique approach based on the 3 C's.
Comparing your coverage options to make an informed decision.
Confidently choosing the health insurance solution that best meets your needs.
Caring service. We offer virtual and in-person support to our clients because we care and want you to get the best value for your health insurance and healthcare dollar.
Horizon Benefit Services has decades of experience helping our clients navigate a complex and changing landscape. Our team will advise, broker, and advocate for you.
Come for the insurance and stay for the care.
When you log on to Plan Your Lifespan, what you'll find is a very easy to understand website. It features things like what will happen to me if I get hospitalized, if I fall, if I have signs of memory loss, what do I need to plan for, and what services am I entitled to through the different organizations in my local area. And what's great is that you can actually email your responses to your loved ones. The loved ones can have a sheet of paper saying, this is what mom wanted, this is what grandpa wanted, this is what dad wanted. And this is such a relief to so many family members. So it is a way of getting this into people's communication, into their discussions before an emergency happens. This is about ensuring that seniors have a voice and that they know and their families know what their wishes are down the road.
Demystifying Senior Living, Choosing the Right Path by Gail Niksic, Vice President at Elderwerks, is being sponsored today by PACSM, A+ accredited senior move managers located in Northwestern Illinois. PACSM provides organizing, decluttering, packing, setup, staging, interior design, estate sales, cleanouts, and specializes in collectors and helping them distribute all of the products that are in their house. Please welcome Gail Niksic.
Good morning, everyone, and welcome to the Elderwerks Aging Better Expo. Thank you for joining us. I'm Gail Niksic, and I'm going to share with you a little bit about demystifying senior living, choosing the right path. A little bit about me. So I've worked in the industry for about 20 years plus, and I've worked also inside senior living communities. And I also chose this career based on my personal experience. And there you have me and my mom in the 1980s hairdo. So I just wanted to share with you about my own personal journey. Also about Elderwerks, we are a nonprofit, a 5013C, and our funding includes event sponsorship, individual donors, foundation grants, and a lot of the senior community support. Our role is really to help and be advocates for the older adult. We provide older adult seniors and families complimentary information, care coordination, referrals, and guidance for senior living and care. In a non-COVID world, typically our model is boots on the ground, assisting families in person whenever we can. Some of the reasons why people move are they need help with the increased possible medical needs. Maybe it's memory loss, perhaps it's a fall, a stroke, activities in daily living, some medication concerns, possibly a recent loss of a spouse, difficulty maintaining their current home, wherever that might be, change in a support system, nearby family or friends, for regular check-ins, and sometimes expressed feelings of loneliness. And we know that recently, due to COVID, this has been on the increase as well. What are the senior living changes that occurred during COVID-19? Senior living communities have advanced health and visitation protocols include personal protective gear, safety practices, infection controls, monitoring temperature on a daily basis. The staff is continually trained on safety and health protocols. Tours were virtual. Sometimes they're a hybrid now. They can be virtual and some in person. Just know that the apartment someone selects is always ready when they are. And also you do have to show that you're vaccinated and have a negative COVID test 72 hours before moving in. Just to go over some of the specialized senior living, we have retirement living, independent living, assisted living, supportive living, memory care, Alzheimer's care, continuing care retirement communities, home sharing, group homes, sheltered care, and respite, also known as short-term stays. In your typical retirement community, which is an active lifestyle, it's usually houses or condominiums built for seniors. Generally, it's 55 and older that live there, and there's also an array of activities and programming throughout the community. There's wellness centers and other support system for the residents, and it's definitely a maintenance-free living. And you probably will see some of these active communities with a lot of golf carts because there are probably houses that are anywhere from 3,500 to 6,000 houses in a community like this. Continuing care retirement communities, known as CCRCs, they also encompass all levels of care. They have an entrance fee. So entrance fees of communities are to cover the entire continuum of care. So active, healthy seniors can enter the community generally as independent as possible, and then if need be, they would advance through the levels of care without having to move to another community. It's very, very similar to the purchase of a home or condominium because there is a significant amount of money that you are putting down to enter a continuing care retirement community. And typically, the attractive piece of it is that it is new residents should be independent, and it's always on a case per case situation on a CCRC about move-in at what level. Independent living, 55 and plus, the older adults who want to live in this active setting and not worry about daily chores, house maintenance, who wants to go out there and worry about the snow shovel, lawn maintenance, cooking, housekeeping, and they're also like mini college campuses, the socialization opportunities. It's also the housing is more compact and it's easy to navigate and there are no chores. So depending on the location and services, the cost can range anywhere from $1,800 to $7,000 a month. And again, it really depends on the location, also the type of apartment you select. So that could be a studio or perhaps a 1 or 2 bedroom. So these costs vary. Home sharing is very interesting in terms of a model. So the idea behind home sharing is so that it does connect the seniors who have a room in their house to rent to individuals who also are seeking affordable housing. Now, it is not for everybody, I will have to tell you that. So every setting is different and every seeker or provider may have their own set of requirements. It's more of a in-depth matchmaking process in terms of trying to make sure it is conducive for both the homeowner and the person who is seeking to find a room in someone's home. But it's nice because it does provide some companionship, and also you can still maintain your independent lifestyle. And also you might arrange something with the person who owns the home where you're sharing the responsibility of some of the chores or errands and grocery shopping. And this does allow you, if you are possibly experiencing a financial hardship, to remain in your home and your community. A group home are private homes, sometimes in a residential neighborhood. You probably don't even know that a group home is there. They typically will have less than 12 residents. They do have live-in caregivers, trained CNAs, and there is no nurse oversight in the group home as well. It's very private, so it is typically like a home setting. It also will include the meals, medication management, all personal care. It also started in the West Coast and was called a boarding care or residential care home. And I'm not sure why that it was given that name and why the West Coast was more attractive to house residents needing some care, but just think about it. If it only houses up to 12 residents, that individuals can get care more on a personalized basis. Let me tell you about assisted living. It's not nursing or retirement home. It's rather a long-term care option for seniors, and it still is considered a social model. So everyone does have their own apartment in assisted living, and the services vary from community to community. And it's always based on an assessment of what their physical and medical needs are. For the most part, assisted living residents are independent. They just need some oversight with assistance of activities of daily living, such as bathing, dressing, meal preparation, medication oversight, and transportation, typically to their doctor appointments or church or synagogue close by, but not necessarily the 24-hour supervision. When you want to consider assisted living is the American Health Care Association and National Center for Assisted Living reports there are over 1 million adults in assisted living. And it does provide a really good balance for individuals who need some assistance throughout the day, but also truly want to remain as independent as possible. And it's not complex or intensive care. And like I said, it's social. So residents will always come and go as they please. So When to consider the assisted living is when older adults need help with their activities of daily living, and that's usually when they need help with possibly more than 2 of these, whether it's medication management or meal preparation, even transportation and bathing or dressing. Also, if they need some more socialization, and can the person benefit from assisted living community? And it also, would assisted living reduce stress? And have you had conversations with family members and physicians about thinking about assisted living? And is your own mental and physical health suffering? So these are some of the things to consider about when you're looking at an assisted living option. Supportive living facilities, they do accept Medicaid. I'll go into that in a little bit in depth a little later, but the residents do benefit from this program, and they also emphasize personal choice, dignity, privacy, and individuality. It is truly an alternative to a nursing home, so it's that financial component that's really important to know, that you can stay there if you are struggling at home, and assisted living, which is private pay, is not an option, that someone could live in a supportive living, probably truly to the end of their life. But families can enjoy that peace of mind knowing that that loved one is receiving help with all of those activities of daily living in a supervised setting. Right now, we have a total of over 136 supportive living communities in 70 counties in Illinois. So together, these community houses have more than 10,500 apartments. So the typical supportive living model is for those older adults 65 and older. Memory care communities, they're also built for the safety in mind as a secured property, and it also will help with all of the daily routines. It is for Alzheimer and dementia patients, all forms of dementia-like symptoms, all activities, the meal programs, daily lives are structured and accommodate their conditions. Medicaid is not accepted at most memory care communities. So if you're just starting to look at options out there, you might come across some terms and maybe you're not familiar with them. This one in Illinois is sheltered care. So what this is it provides more extensive care than assisted living. The license for sheltered care is for the entire community. So wherever you're living, this license covered care in that community. As I mentioned, CCRCs, it also will have a sheltered care license. So if someone is living in independent and they need slightly a little bit more care, sheltered care, they have a license for that. They can take care of the individual. It just kind of results in people able to age in place longer with fewer moves and interruptions, and typically Medicaid is not accepted here. A skilled nursing facility is for those individuals that need a higher level of medical care. And they also have full staff of nurses and CNAs, typically for older and disabled adults with long-term care needs, including complex medical conditions. And they could be residents that are either mobile or immobile. You will find that there's 3 meals a day served in a dining room or at bedside. Also have scheduled activities. They're regulated by the Illinois Department of Public Health, and they also are subject to a survey every year, which is available for viewing by all families and visitors. And you can ask to see the most recent survey by the Illinois Department of Public Health. And what you're looking at is to find out how they scored for resident care and overall status in terms of anything related to the direct care for residents in this skilled nursing facility. Skilled services are covered by Medicare for short-term stays. Skilled services may be covered by Medicaid for long-term custodial care. How does assisted living differ from a nursing home? This is a pretty good question in terms of how people say, share with me what is the difference. Well, nursing homes are designed to care for more frail individuals, and they're not able to care for themselves and have possibly numerous healthcare requirements. Assisted living, on the other hand, are communities that are also deemed necessarily when a person in question needs help preparing meals, bathing, dressing, toileting, performing household chores, and sometimes confused or experiencing memory problems. So questions also come about, and how do you pay for this care? Well, all good questions. You know, you can certainly pay with personal funds, personal assets, long-term care insurance, reverse mortgage, veterans aid and attendance, pension, and Medicaid. Just a little bit about reverse mortgages. That's a typical question that people ask, and probably seen some of the commercials about it. And it's very true that these are available for individuals 62 years or older. And a reverse mortgage can be a good way to get cash when your home equity is your biggest asset and you don't have another way to get enough money to meet some basic living expenses. So a lot of people have used getting a reverse mortgage if they need some more care in their home. That's certainly acceptable to use and get a reverse mortgage, and allows you to keep living in your home as long as you're able to keep up with your property taxes, maintenance, and insurance, and don't need to move into assisted living or nursing home for more than a year. One of the other ways to pay for moving and getting care in a community is through the Veterans Aid and Attention pension. So the Veterans Pension is available for individuals needing care in the home or a senior community. It's possible to get this tax-free pension to offset the cost of care in a private care community. There are general qualifications, which I'm just going to go over shortly. And also there's a look back period for gifting. It's 3 years, but not beyond October 18, 2018. The Veterans Aid and Attention pension is not to be confused with Medicaid, and they're not to be used interchangeably. So they all each have their own set of guidelines in order to get this benefit. Here are the basic qualifications. You need to be honorably discharged. You have to serve 90 days of active duty, serve 1 day during a wartime period, must be receiving and paying for care. Current cost of the medical care exceeds current income, and your surviving spouse married to the vet at the time of death 1 year more and not divorced. The veteran's physician states there is a need for assisted living type services and or home care. So there is a form that the physician does need to provide to indicate that the individual needs help in their home or move to a community with help with at least 2 or 3 of activities of daily living. The claimant should not have less than $80,000 in household assets, excluding the primary home, car, and personal belongings. Medicaid does cover low-income housing. That was one of the things I touched on with supportive living and care for anyone in the program. You get $30 from Social Security that's left for personal use, unless, of course, you do have the veterans pension. Covers long-term care at home or in a facility. It's hard to get Medicaid coverage at home. You must spend down. So what that essentially means is when you're down to $2,000, that's when you can apply for Medicaid. And if you had gifted some money, you must pay back money given away within the 5 years. And it can be a hardship for families when you are looking for a skilled nursing facility because of all the information that you need to gather in terms of applying for Medicaid. What's the difference between Medicare and Medicaid? Okay, so these are real important takeaways. Medicare is a federal insurance program. Medical bills are paid from trust funds, which are covered and paid into. It serves a population of 65 and older, primarily whatever their income, and serves younger disabled adults and dialysis patients. You can always get more information on Medicare by going to the medicare.gov website. Medicaid is an assistance program that serves low-income people of every age, and usually individuals pay no part of costs covered for medical expenses. Medicaid is a federal state program, and it does vary from state to state. So again, you want to go to their website for additional information, medicaid.gov. The resources on Area on Aging, funded by the federal and state of Illinois, has a contract with nonprofit agencies to help low-income families. Catholic Charities is one of them. That's one of the local providers. The program financial net limit is $17,500, which will help with daycare, congregate meals at senior centers, community care program, caseworker, pre-screening, electronic monitoring, and money follows the person. Some of the questions: how to ask for help. Really important is you really need to decide what you need help with. Think of someone who might be able to help with that. Sometimes it's even a neighbor that you've had, for many, many years if you don't have any family that's close by. And really be honest and direct about what you're seeking help with. Lower your expectations to be open to others' needs, and be grateful for small acts of help. Any information is really powerful, so any information and how you can get help is extremely important, but don't be afraid to ask for help. So I wanted to share with you a little bit about a family that I recently was working with, and I just love, how this outcome was, but I just want to tell you about the daughter-in-law who called me and told me they moved her mother-in-law from her own individual home, and she was extremely independent in her home in Arizona. So this was about 7 months ago. So Florence is now in their family home. So the daughter-in-law said that she also has their grandchild living in their home. So now it's 3 generations of individuals living there. She also feels that she has a great, healthy relationship with her mother-in-law. The goal is really to eventually move Florence to assisted living. Meanwhile, the family, her and her husband, are downsizing, and they were looking to move, sell their home and move. So they wanted us to help identify some assisted living communities closer to where they were moving. For now, they really felt that they can just get a caregiver to help her mother-in-law, and they just weren't quite there yet. So what I did was I introduced them to a geriatric care manager, and the geriatric care manager spent some time getting to know and understand Florence. And by the second time, she had broached the idea of a caregiver, and Florence was extremely receptive. So a couple months have passed, and Florence has bonded and flourished very well with the caregiver. The daughter-in-law said Florence's attitude and well-being has improved significantly. So when I gave the daughter-in-law a select number of assisted living communities to look at, they initially took a virtual tour. They narrowed their search down to 2 communities they thought that Florence would like. And then once they were able to actually go to and view these 2 communities, Florence went with, she selected an apartment, and she moved in, and she's so comfortable with this apartment and the community, meeting new friends, and she's now living close to her son, daughter-in-law, grandchildren, and she's very happy with the outcome. So some of the resources, and there's so many more resources out there, I think when people are just starting to seek and gather information, you'll find some from the National Council on Aging, resources for older adults and caregivers. Just know there's also a lot of blogs out there, especially for family caregivers. There's also the Aging Life Care Association. What this does, it helps you locate an aging life care professional. It's also known as a geriatric care manager, which I just referenced in the case study with Florence. So in the event that you have a loved one out of state and no other family lives there, and you want to possibly get a geriatric care manager to do an initial assessment or just go and visit and see how things are going, if you sense that there's some changes in your loved one, look at this website and you just put in the zip code of where your loved one lives, and it'll give you some names and contact information for geriatric care managers. You can always, of course, find a lot of this information in the Elderwerks Senior Resource Directory, which you also know is available online. There's also some great topics with the Family Caregiver Alliance. They're always very active, and feel free to subscribe to that to get their daily or weekly information. And also, as I referenced, with the information on the Veterans Aid and Attendance Benefit, out there is the Illinois Department of Veteran Affairs, and you can locate an office close to you and call up and find out if you need to schedule an appointment for seeing them in person. I think all of you recognize Dick Van Dyke. This is how Dick Van Dyke today, and he says, in my 30s, I exercise to look good, in my 50s to stay fit, in my 70s to stay ambulatory, in my 80s to avoid assisted living. Now in my 90s, I'm just doing it of pure defiance. And I thank you once again for your time. And now I'll open it to any questions you have.
All right. Yay. Hi, Gail.
Hi, Jennifer.
That's so exciting. We actually get to talk at our own expo. Woohoo!
Woohoo is right. I hope everyone is safe today. I hear all the thunder is going on outside, so hope everyone has some power.
There's some severe weather out in the west moving east right now. We have a storm in Palatine and a storm in McHenry County, and the southern suburbs are getting hit, so be safe. Just want to remind people right now from 11 a.m. to 11:30, there'll be tabletop discussions by professionals in our Elderwerks world. Jesus Enriquez will be talking about Medicare fraud, 11:30, and then at 2:15, Carrie Peck, who is the founder and elder law attorney at Peck Ritchie, will be at the tabletop in the bandstand area. Please, please fill out your evaluations for all the speakers. We need those evaluations. We need to know who you like, who you don't like, where you want to see improvements. Our goal is to serve our clientele and families who have questions. So we may not have the same ideas that you all have. So Gail Niksic here is my vice president at Elderwerks, and I love her. She's my right arm here. And then Emily, of course, the office manager, is my left arm. So, you know, without them, I think we would be struggling. So thank you so much for everything you do, Gail. It's most appreciated.
And thank you for always being a cheerleader and supporting us, and always coming in with a happy face.
Oh, thanks. It's a love fest. So some of the questions that I know I get a lot, and I know that Elderwerks team does, is mom is fine or dad is fine, but there are some minor changes. What can we do to prepare for the future? Those are, you know, some of the basic questions. We have a lot more, but what are some of your suggestions in preparing for a future after the age of 60?
Now we're talking about the age of 60. Well, everyone changes, as you know, in terms of their, especially if you're not seeing them. And we do know that there's a lot of family who might be out of state. And we know what COVID has done in terms of some people haven't seen their family for almost 2 years now. So you can always, whatever you do, be proactive. So right. Again, you know, if it's like, for example, let's say that they had the same doctor for 35 years and you find out, gee, mom and dad's doctor is retiring. Well, how do you find a new doctor? So who's going to be able to follow them? Do you need a geriatrician? But, try to make lists in terms of what's important, see changes. What if they've been living in the same neighborhood and there's been a neighborhood watch and they've always looked out for mom or dad, and all of a sudden this neighbor is moving and they're no longer there in their support network. Try to find some other people that could just, whether it's just picking up the phone and checking on them, but make lists in terms of questions to ask. As you know, the directory that we publish has a multitude of resources out there. If there's some just minor changes and there's some balance and falls, look at all of the alerts out there to get for someone. But just know when there's a change, especially if there is a loss of spouse, they are now a little bit more isolated. See what you can do to encourage them in terms of participating in activities, whether it's online or in person for activities.
Yeah, and that's important. You need to keep your loved ones and your family active and social. The lack of socialization, as we know, causes a lot of problems with people staying home. And during COVID, a lot of people did have a change in their memory, had some physical and health emergencies due to the fact they were isolated at home. So I appreciate that. An article that I just wrote came out, How to Start the Conversation Over 60. One of the things that I would like to discuss with you, Carol, Gail, whoever you are, you can tell I need help here at Elderwerks. Gail, seriously, is caregivers. We have a lot of caregivers, great people who are taking care of loved ones because the loved ones expressed they'd prefer to stay home as long as possible. Do you have any advice for those caregivers in terms of what they can do to protect themselves and their loved ones at home?
So we're talking about your the family caregiver.
Family caregiver, correct.
Right. Okay. So this is always something that I have a discussion about. So I feel that the caregiver, they're doing it not because of obligation, they're doing it because of love. And I get it, you get it, we all get it. But remember, that caregiver also has to take care of their own health. If they are starting to have struggles and not asking other people to step in, whether it's another family member or it's someone else, they are going to be of no value to whoever they are the caregiver for if they're not taking care of themselves. I get it. You know, there are couples that have been married for 55 years or better, and their role is to take care of their spouse. They need a village. They need people to help with this whole process. Mm-hmm. And they really need to enlist the help of someone else just to make sure it is working well for everybody involved.
I think a lot of the adult children have a little bit of guilt. What do you say about that guilt?
What do I say is that you're talking about the obligatory approach in terms of why they have the guilt and do that. I'm not sure what the guilt is. I just know for a fact that in my viewing it is that our parents took care of us when we were growing up. It's our turn to take care of them. And if we're lucky enough to live in the same state as them, that's great. If we're not, in terms of the guilt, you know, I understand it. You know, they have their own lives and their own families and they live somewhere else. Then get somebody else that is really going to be the eyes and ears for their loved one. But I don't know about the guilt. I didn't experience it. I know that we had terrific caregivers, both family and other caregivers for our mom. So, and it worked out really well. It really did.
I just read somewhere that, God, what was the quote? The quote was, your parents loved you and you love them. You are obligated to take care of them, but you don't have to personally take care of them. You just have to make sure they're taken care of well. And so those folks who are at home taking care of a loved one because they feel obligated or because they really love the person, and it's getting harder and it's getting more difficult to take care of the person due to their physical limitations or their cognitive impairment, it is not wrong to ask for help. It is not wrong to move a senior into a senior community if that is the best place for them to thrive and be safe. There is no guilt there. I agree with you so much, Gail. And you had some adult issues with your mom. And I know when we talked about you and your mom, you loved your mom and you still love your mom. And you did everything you thought was right for your mom. And the key is you did everything you think is right. Making a decision to stay at home with your loved one or transition into senior living is a personal decision. No one can make that decision for you. However, never make a promise you can't keep because we don't know what the future holds for us, right? Yeah. So for instance, if something happened to me and I ended up where I needed total care, I would never want my family to keep me home and take care of me. That would be their 100% job. They would have limited, basically they have no life. They would just take care of me. I would want to move where I would be taken care of well. That's it. You can have your loved one in your life, but not in your home. You can still be the daughter or the son and visit them wherever they're living, and they get the socialization and they get the support they need and the meals and the housekeeping and the laundry service and the activities. You know, sometimes it's living on a cruise ship. These independent assisted living buildings are ridiculous.
Oh, I know. I remember, in fact, it was a few years ago, and I was touring with a son, and it was a community that had assisted living, memory care, and skilled. And they had just remodeled the skilled nursing wing. So he said to me, he said, you know, I could live here. And I said, really? And it was just, it made it so enticing in terms of, you saw that even though it was a clinical, there is, hospital beds there, they made it so inviting and just so, it's so someone could come in and say, you know what, doesn't really, my vision of skilled is not like this. And he was very comfortable making that decision of moving his mom there, which ultimately he did.
Which is great. I know we also get a lot of questions about assets and income. So if you have assets and income, you have choice. But just because you are on a limited income or a fixed income or restricted income, whatever you want to call it, does not mean you don't have choice. You have less choices, but you still have choice. And Gail, I know that you've helped a lot of families that were on restricted income and in different levels of their lives. What does that look like for someone on a restricted income? What do they have to look forward to?
I always say, again, we can help anybody when it comes time to what, as you mentioned, what their income is. And there may not be as many options, but there always is going to be options. Number one, if they're currently living somewhere, are you willing to consider, maybe 25 miles away from where you're living right now, because there might be more options. So thinking about that, if we can have that conversation, just know that and Illinois is very fortunate when it comes to the senior housing financial piece of it. There are many states that do not have that model for supportive living. If you can move to supportive living, with little or no assets, just know that if your health doesn't change significantly, you can stay there until your end of your life. Now, again, years and years ago, I'm talking 25 years or so, that person only was able, because of their limited income and assets, to go to a nursing home. And that's not a quality of life.
No.
If you can move to a community that you can get all your meals, you can have the socialization, meet other individuals, and really supportive living is just such a great opportunity for older adults.
Oh, I love supportive living. There are some gorgeous supportive living facilities. They've got theaters, and some have fire pits and patios and really good food. I'm not worried about aging in Illinois at all. Thank God. Knock on wood, right?
Right.
Illinois is a great state. And now in terms of the veterans benefits, I know you touched on that a little bit. The veterans pension, survivors pension, and then there's also the Agent Orange disability pension. Who should they reach out to for something like that?
So I always say, and I get a lot of those type of calls as well. So we really want to make sure that we're talking about the qualifications of an individual. So when we say, is it for mom or dad or the surviving spouse? Once we identify that they can qualify, you can go to the Department of Veteran Affairs for that. And just like the security office, Social Security office, those offices are not open. So you can get that information by phone in terms of, and then you can go to our website to get all of the qualifications. But I think the Department of Veteran Affairs is your best go-to for that. And it's a wonderful pension out there to help supplement the cost for care, whether you're in getting home care or actually moving to assisted living.
That's true. And I know that the Veterans Assistance Commission in Lake County, McHenry County, and I think there's 10 other counties in Illinois. We're lucky because most states don't have Veterans Assistance Commissions. They help also, and they're still open, right?
They're still open. And I think when you call their number, they will give you the hours that they're open. They may be open limited, in terms of, and they do suggest that you make an appointment for that. But I think, again, there's so much information just to make sure that individuals qualify. And then I always tell them that they are going to need a physician statement saying that the individual needs help, but that cannot be older than 90 days before they apply for that benefit. So we want current information regarding medical.
Okay. And then if someone's moving into a community, what are some things they should do to prepare to go into a community? Are there some things they have to do to be accepted? Are there things they have to do to move? What do they need to do?
Well, it depends on how much help you're going to get for someone moving into a community. So once you decide on a community of your choice, you're going to have to, you have a house, or an apartment or a condo or something. It's certainly not going to be the same size, square footage as the place you're moving. So you and your family and friends need to discuss, what's going to go with you, We're so fortunate to have our sister company, Paxum, come in there and do a consultation to see, again, help them with that entire process, whether things that you're going to sell, donate, but help them with that whole process. And what I found was so nice about working with all the Paxum folks and helping with this process is that it's really, they're having conversations about their next step in their life. So while they're working with them, they're really preparing them for moving to that community because they have so many concerns, you know, about moving from this home for 30, 40, 50 years. And they help them really acclimate a lot faster with this whole process. But the more you can do in advance, and I have people telling me today that though they haven't made a decision to move somewhere, they are actually starting to declutter. And I go, wow, those are music to our ears.
Yeah, no kidding.
Right. So you don't have to do it all, hurry up and do it. I mean, if you just do it in stages, you're much better off. You have no use for something, get rid of it, you know, but just know that if you're planning on doing something, whether it's 6 months or a year or 5 years out, start preparing yourself by decluttering because you probably will be moving to a community with an apartment that's much smaller than where you live now.
Right, unless you're in a CCRC. So if someone is moving into an independent living or assisted living situation, do the communities come visit you? How do they know what level you're at? Do you have to do any medical tests? What's required on that? Do you know?
Yeah. So again, when it comes time to making that decision and families say, well, I'm not sure if my loved one fits in an independent or assisted living. And I said, they will want to do an assessment on the older adult. I don't think the assessment is an in-depth assessment. It's really more like a 30-minute interview. You know, Jennifer, tell me a little bit about yourself. You know, where were you born? You know, kind of what, you know, maybe a mini mental, what year is it? Things like that. Tell me what you enjoy about your home. But they really want to see the cognitive level of an individual, want to see where they're at. So it's always in Illinois, they always have to do an assessment on an older adult just to make sure they're appropriate for what level of care, where they're moving to. And that's really to avoid a person moving and then all of a sudden a month later finding out they need another level of care and it wasn't an appropriate placement to begin with.
That's true. Now with COVID, are they making people get vaccinated in these buildings or are they allowing people without vaccinations into these buildings right now?
No, they have to be either one of two. They have to be vaccinated and they have to have a negative COVID test 3 days before they move in.
Okay. Well, that's good to know. They're trying to keep those seniors safe, which makes me happy.
Oh, yes, it certainly is. And I think just in the same for us, when we visit, there's a whole process of screening. When we go in, they take our temperature, we fill out a form. Have we been out of the country? Have we been in contact with someone? So all of them have a lot of precautions in place, but everybody has to be screened when they come in to visit their loved one.
And what I've heard is throughout COVID, I mean, last 2020 was just a horrific year. It was horrific. And I know you have a lot of clients you've seen have issues due to the fact they didn't move when they should have because of COVID. What I think people need to understand is this is unprecedented times. Like they say this, right? 2020 is not normal. It's not a normal year. Everyone's just reacting going, oh my God, what do we do to protect our seniors? So many of the communities had basically locked down their buildings to protect their seniors. The seniors were in their apartments, but what the community needs to understand is they still had 3 touches, right? They still had someone coming to their apartment to check on them. They still had breakfast, lunch, and dinner delivered and activities. So they had a touch of socialization every day. They weren't isolated. I think people need to know that. And when you aren't allowed to see your loved one, it's not because they're being mean.
No,
it's because they want your loved one to thrive and be safe. So that's something I think people do need to know. It is 2021. We're better off than we were, but you know, with the world not doing all the vaccinations they should have, we have some issues. So they're going to protect their seniors always. That's their priority.
Right. And then, you know, a lot of the communities have told us, and you know, you've been involved in this as well, how they keep their residents engaged. You know, there's technology. They're using their iPad, they're FaceTiming, their video chat. They're doing everything they possibly can do to engage the resident and keep them extremely active, even though they're not possibly able to see family members and other visitors.
Right. And the one thing I do want people to know about Elderwerks is that we do track all of the communities, most of the communities in Northern Illinois. We do. We tour them again. We have toured them often for the last, gosh, how many years? 13 years. We've been in and out of those communities all the time. We hear everything good, bad, and ugly about every community. And what sets Elderwerks apart from the consumer, if you will, is we do have the knowledge base to help you figure out which community is best for you. Now, we're third-party endorsement as well, so we will tell you anything you want to know about the communities out there. So if you call Gail and you say, hey, Gail, my mom needs assisted living. We've looked at this place. These are her issues. What do you think? Gail's going to give you the truth. It doesn't matter if they're in our network or not. She's going to give you the truth. We don't lie here at Elderwerks. We do try to protect our seniors and make sure they go to the most appropriate place. What do you think about that? What do you do in those instances when someone says, hey, what about this community, this community?
Well, they have to do due diligence. I always say that you should ask as many questions. And I also feel that is definitely very appropriate to ask any question because they're paying a certain amount of money every month. So there is nothing that is off base in terms of asking them questions, even as far as asking other residents if they're able to tour in person. Tell me a little bit about what you like in this community. So they hear it from the perspective of the resident already living there. So, you have to just be informed, ask as many questions as possible, because we always want to avoid that person moving and saying, you know what, they've said, my mom or dad said, I hate it here. Well, what do you hate about it? And again, if they're hating it, maybe because they're just not used to the change for the first 30 days and
Right.
it's taking them some time to get used to it. Maybe there's some staff member that can spend a little bit more time with mom or dad. Get to know really what's on their mind and why they're so angry about being there. And maybe they can just connect with that staff member or a volunteer or someone else who comes in. But
Right.
I just think it's asking as many questions as possible. And I do feel that asking other residents what they love about the community is really important.
Oh, so they're living there. They should know better than anybody. My motto is call Elderwerks first. Call Elderwerks first before you start doing, calling every single community and visiting them. There's about 900 opportunities just within 50 miles from Palatine. There are so many opportunities for our older adults. But if you find communities and you go and see 10, 20, 30 of them, the issue is they all run together. You don't remember much, right? And you may not choose the best place for your loved one because you're now just overwhelmed. So Elderwerks can reduce your search to maybe 5, 6 communities that are based on your loved one's needs, right, Gail? And then you make a decision.
Right. I mean, because you know of 13 communities in the area, those necessarily may not be the right fit. Try to prioritize them on what you're looking for, whether it's the geography, whether again the level of care, close to doctors, things like that. But 13 it seems to be a lot. Someone said to me they put together a spreadsheet, and I said, oh, I'd love to see that spreadsheet. What you put in, what it did, what it didn't have, and things like that. So I just think it gets a little bit too confusing, after you looked at 4 or 5 different communities to say, what else can they offer? And there's so many opportunities out there for our.
We have a touring checklist on our site, so they can stay on task.
And we send that. Not only is it on our site, but in an email, I will include that. So I go, here are the questions to ask. Right. And I said, you won't even need that list, after you tour it like the second time, because it will come first nature, to ask those questions.
Well, you just need about 15 minutes to give them some direction and you're good. They're good to go. They will not waste any time. They'll know exactly which communities are best suited. Right.
Yes, absolutely.
I just got a referral this morning, a phone call from a gentleman who was referred by another senior community that community offers assisted living and memory care. Well, he was looking for independent assist and he was restricted income. So his options are limited. However, he can go on supportive living. He has options. I sent him 6 communities to look at. So He does still have options because he's still mostly able to do everything himself. He's just got, some minor medical issues. No problem. So it's best to talk to an expert before you start the search process. Our expert, Gail, our other consultants, we're all over the state of Illinois, southern Wisconsin, western Indiana, but we also can help nationwide if it's a private pay situation, because the problem is if we can't tour the community or the SNF, the skilled nursing facility, it's hard for us to refer something we don't know about. We do have partners nationwide that are for independent assisted memory care and home care agencies as well. So we can assist and we can say, hey, maybe you want to look at this place versus this place, because we know more than most folks out there.
Right. And then I always say that, just know that if you're a sibling or someone has questions, we can always do a conference call. We can do a Zoom, because maybe your sibling has some questions. They're out of state. You're the one that's here. Instead of emails going back and forth, I can answer the questions for them right there when I have them. But I'm always happy to answer any question regarding all the different levels of care and communities.
So if someone needed help, they can how do they get a hold of Elderwerks, and what does that process look like? Because I'm not a consultant. I don't help families typically. I start them and send them on their merry way. What does that look like for our typical consultant, Gail?
Yeah. So, there's so many different ways that people get in touch with us. And sometimes it's been another family member that we've helped. And sometimes it's many of our professional referrals that have worked with us in the past. But contacting us, by phone and email, and what the process is this: we always do a I would say a very comprehensive intake and knowing about the individual. Again, starting with the financial and most of the medical and the geographical, what they're looking for, where they want to ultimately go. We take probably a good 20-25 minutes in terms of this intake process. So once we have all the contact information and a little bit about the resident, we will send them an email. And again, we want to emphasize that these are resources. These are not recommendations. These are places and communities we've worked with for a very long time. We're giving the family or whoever else is the advocate the tools so they can make an informed decision. We also wanted them to come back to us after they've toured and then again present a whole nother host of questions or possibly concerns. They say, oh, Gail, I toured this place. I didn't see this. I didn't see that. Okay, my suggestion is possibly go back a second time, go a different time of the day.
Right.
Those are some of the concerns if they're talking about very little activity, or they're talking, well, maybe now they're not doing, the dining room experience for everybody. I'm not 100% sure on how the assisted livings are doing that right now. But I said, you're also, even if you have a concern about whatever that might be, maybe that's a question for their director of resident services. Maybe that's a question for the director of wellness for clinical. Mom's, can able to monitor her diabetes. Who can help with all that? So you want to talk to a whole team at the community if you're interested in that community. But we have ongoing conversations just to make sure we're tailoring it to the specifics for the family and the older adult and making sure we're making the right resources to send to them.
And when you're talking to them about the senior living options, are you also asking about is their legal documents set up or any of that?
We touch on that, and I always, on that particular one, I usually don't have that question right from the, starting off point. I do conclude with that, and I will ask something to the effect of, just want to make sure, are there power of attorneys in place, for your loved one? And they will share with me perhaps if they have or they don't have. And we, of course, do get asked if we could give them referrals for that purpose if they don't have it. We talk about the long-term care insurance. We talk about all of that. We cover all of that in our intake process.
Oh, good. Because, I don't listen to you guys talking to people. Honestly. We did have a question. It says for Vicki Madigan, she has an employee who wants to know if we serve Northern Indiana. And the answer is yes. We do serve Northern Indiana.
We certainly do.
If you have questions, just call us. And if we can't help you, we know who can. So, we're not for profit. We help all older adults and seniors with any question. We're like senior guidance counselors. What do you want to know? Right?
Yeah, I would say the amount of questions that we've had, especially in the last 18 months, has increased. And I think that we should be very proud of what we do in terms of helping them. I always just say we like a challenge. We don't give up. We always will answer that or research it for them. We'll absolutely help them. As maybe some people don't know, we actually have someone that helps with our social service cases, and she's wonderful. She's very patient. She asks a lot of questions. A lot of people don't know there's also a supportive living model for people who are visually impaired. Yep. Those are all, that's great. And the age requirement isn't 65 and older. It could be someone under the age of 65. So again, there are a lot of resources out there please feel free to give us a call, send us an email, and we'll always get back to you very promptly.
Thank you, Gail. So just in conclusion, Elderworks is fabulous because, you know, this is where I work. Elderworks does not discriminate for any reason. We will help any older adult or senior. Just remember, when you go online and you do a search, there are organizations out there capturing your information. They are selling your information and they're sending your information out. And that's a problem. I think our legislature should prevent that. I think it should be illegal, but that's my own opinion. Here at Elderworks, we do not capture your information to sell. We do not capture your information to give away to anybody. It is used for your purposes. So if you want referrals, we're going to tell you, we're referring to ABC communities. They're going to reach out to you. You'll know exactly what's happening. Or you might want to know that you're going to be on our newsletter list. You will be on our newsletter list. Yes, just opt out if you don't want to be a part of that. It's only once a week on Mondays for education for consumers. But we don't sell your information. We are here to help. We are a social service agency, and we do not want to make income on you by stealing your information and selling it. I think that's just wrong. It's just me.
Yeah. So, part of what we do, a lot of what we do, I should say, is really the education process. So, yes. Again, we're telling people that we do share the information with the community only that we're referring them to. So what is the best way for them to get in touch with you? Would you like to be do you want them to reach out to you via email? Sometimes, they go, I'm a teacher. I don't want to be, someone can't call me until after 3:30. So we really want to make sure we're respectful of their wishes of how they want to be contacted. And also, I think that's another thing that we do is fabulous. The fact that once a decision is made by the family and they have selected a community, we will send an email to the other community and say, this family has chosen this particular community. It's all about the communication too. That's really what it's all about.
Right.
But we welcome all of those responses, feedback from families. Like you said earlier, we want to know all about the things that were appeal to them and some of the things that were maybe not so appealing. So we either need to address it with the community or depending on the wishes of the family, we don't, but it's very important for us to get that feedback about the communities. I think that, since we haven't been able to go into a lot of communities, we haven't been able to see the condition of the community. So I'm not saying that, a community is 25 years or older is starting to show some age, but, maybe it needs some love. Maybe something needs to be done that it's not that as appealing to the family because they saw the, 1980s Miami look or something that was not being taken care of. I don't know. Right. Everything is different, but I always just say, go in there with an open mind, go in there, ask the questions you need to for your family member, but don't look at the wallpaper necessarily right off the bat, ask about the care, and then maybe look back at the wallpaper and say, I probably would have chosen a different wallpaper.
But you hit it on the head, Gail. It's all about the care of your loved one. Who cares if they have a chandelier? Who cares if it's gorgeous? What matters is that the people that work there are caring humans that are going to love your mom the way you do. We, or dad, or both, we do not want anyone to choose a building just on how pretty it is. And some of the best communities are older. They just are, and they put their money into their people versus their building. I'm okay with that, right? As long as the seniors engaged, thriving, and safe.
I'm more than okay with that. There's no question about it. You're right. They have really put the money into the staff that's really caring for their loved one. There's no question about it. But, people have different tastes and, they're entitled to their opinion and taste about things like that. But, I can tell someone that I remember going into a community, and actually it's happened more than once now. I've walked in and there is entertainment right in the first floor and all the residents look engaged, laughing, smiling, singing, and happy. Yeah. And I've seen this numerous times in this one community. So I can't tell you, I've gone there many times and this is what I see. So, the residents are truly happy there. So
that's right, Henry. I love all that. I like the happy stuff. It makes me enjoy, get down on it. Well, thank you so much, Gail. I appreciate you, as you know, and I'm sure we'll have you present more topics later at a later date. So if anyone wants to learn more, I'm sure Gail will be doing more presentations in the future. Thanks so much, Gail.
Oh, thank you. Bye.
Yeah, bye-bye.
Elderwerks Educational Services is a not-for-profit 501c3 organization providing senior living coordination, advocacy, and education to. In many instances, our consultants serve as a lifeline or personal confidant to older adults who literally have no one living nearby. Elderwerks prefers senior housing options and providers based on you and your needs. What did you used to do? What do you do now? And what do you want to continue doing? We provide complimentary referral services to vetted supportive care providers and help families and acquaintances secure personalized living and benefit information. Our consultants are experts in senior housing of all types. We have toured the senior communities in Illinois, documenting the services, amenities, and quality of care to ensure seniors transition to the best options based on their individual. People view aging much differently than those of previous generations. Our seniors want to be connected, relevant, and celebrate life in active, vibrant surroundings. We've helped thousands of clients secure and maintain a quality of life that suits their personalities. As the population ages and demand for senior services increases, Elderwerks will be there, offering more learning opportunities, activities, fun, and support that Aging well and planning for future needs can be easy if you call Elderwerks 847-462-0885. Maintaining Positivity for Your Mind, Body, and Spirit is sponsored by Assured Healthcare, who provides post-surgical care, ongoing care for chronic illness, and senior care, along with in-home rehab and care for new mothers and infants. Cori Moschberger, our speaker today, is a therapist and clinical coordinator of senior services at Barrington Behavioral Health and Wellness. Please welcome Cori.
Good morning, everyone. My name is Cori Moschberger, and I am a licensed clinical social worker with Barrington Behavioral Health and Wellness. We have 3 locations in the northwest suburbs. We have a Palatine office, a Lake Zurich office, and a Barrington office. And then we also provide services in private homes, as well as in residential communities, assisted living, independent living, and memory care. And one of our specialty areas is seniors and their families. And we have a team of clinical social workers that serves the community in that way, and we love it. So we can provide services in someone's home or in their residential community. We are Medicare providers, so our services are covered by Medicare, and generally with a secondary insurance that will pick up that additional copay there. So if we can be of service to you or your family in any way, please don't hesitate to reach out to us. And just so I don't forget, let me give you our main number. It is 888-261-2178. 888-261-2178. And again, my name is Cori. I'm the director of our senior services, and I'm glad to get to do this presentation with you today. So this presentation is titled Maintaining Positivity for Your Mind, Body, and Spirit. And what I want to do is just give you 5 really practical ways that you can do this. Maintaining positivity is sometimes challenging. We live in troubling times right now, and we've all been through the pandemic, and I'm glad to see that things are starting to open back up, but it's had a significant impact on us, as well as during the pandemic, life continued to happen, right? Illness and loved ones passing and difficult, challenging times. And so how do you stay positive when the world around you feels negative? I want to give you just 5 really, they're simple steps. They're not easy to implement, but they are simple. That you can do to help maintain positivity. So the first one we're going to go over is change your mindset, which we'll talk about that. We're going to talk about practicing gratitude, staying connected, moving your body, and seeking enjoyment. So those are the 5 things we're going to review today and what that looks like for you. So I am going to ask you to participate a little bit by just jotting some notes down, maybe on a notepad next to you, or if you're on your computer and you want to take a few notes on your computer, I'm going to have you do that along the way. So step number 1 is change your mindset. So this is recognizing the power of your thoughts to impact your feelings. In therapy, we call this the cognitive behavioral approach. And basically, it is using your thoughts to impact how you feel. So one of the things that I work with quite a lot with my clients is chronic conditions, chronic illness, whether that be physical chronic illness or mental chronic illness. Both are the same because your brain is part of your physical body. It is a physical organ, but we do separate those terminologies. So whether it's in your brain or it's in the other parts of your body, chronic illness can be very challenging to deal with. And I feel like changing your mindset around living in a world where things can be negative or feel negative is kind of a chronic condition. We don't have control over what's happening around us necessarily. And so the difference here in approach is acceptance. So acceptance is defined as a readiness or willingness to adapt to a given circumstance. And I like this quote, accept what you can't control. And then next to that, I put an image of what we call the circle of control. And I use this every single day with almost every client that I work with, and I use it myself consistently. So we do have a circle of control, and then we have a circle of influence, and then we have our circle of concern. And usually the circle of concern is what presses in on us, and we feel that stress. And we have to ask ourselves, what is within my control? What can I actually control? Generally speaking, it's us. That's about all we have control over. Now, we may have some influence. We might be able to influence our family members or influence, something else happening in our life in some way. But that circle of influence is usually pretty small, whereas the circle of concern can get really, really big. And when things are out of our control is when we feel most anxious and depressed. That's when we're dealing with some of those symptoms of lack of motivation, or feeling fatigue or tired on a daily basis, not really wanting to do a whole lot, or not really knowing what to do. And so when you circle back to your circle of control and ask yourself, what is within my control? It is you. It is your mindset. It is how you look at things. So in our culture, what we typically do when there's an illness, so I'm gonna talk about this in terms of a chronic condition. When there's an illness, we seek to fix it. We do whatever we can to make it go away. We fight it, right? We go to the doctors, even if we know this is a life, eventually will take our lives, like say cancer, we still fight that illness, right? We go at it. We go for all the medication, all the things that we can do. We want to get rid of that. We want to keep fighting it. And the trick with a chronic condition is that it'll never go away. You can't fight it. I mean, you could fight it, but it's not going to do you a whole lot of good because it's not going anywhere. So examples of this might be the illness of Parkinson's, when someone loses potentially mobility, and is unable to walk anymore. Bipolar is another mental health chronic condition. There's a lot of different things we could talk about, right? But when you have a chronic condition that you have to deal with, we practice acceptance. And acceptance leads to management. And when you can accept, this is chronic. This is not going anywhere. I'm not going to get rid of this. As much as I want to, and as much as the people around me want to help me get rid of it, it's never going to happen. I'm not going to get rid of it. And that's the negative in our world. We're never going to get rid of the negative things that happen around us, unfortunately. That's just part of what we live with. That is our chronic condition as humanity. And so if we can accept that that's the case, bad stuff is going to happen. Bad stuff is going to happen around us, to people we love, and we know that, then we can start to work on management. Okay, so we're going to talk about managing the process of aging. Okay, so the process of aging is a chronic condition, right? And so just like we have to look at the world around us as bad things happening as a chronic condition, we have to accept that and learn how to manage it. We have to do the same thing with aging. Now, I know this is easier for me to talk about because I'm 44, but trust me that the research on this is right. And I work with my individuals on a daily basis to manage this differently than maybe you might have thought to historically, right? So you can stay negative about it and feel down and depressed and anxious, or you can say, you know what, I'm aging. We are, right? We're all aging. And as we age, our body ages with us. Our capacity changes, our capabilities change, our abilities change. We have limitations that are put on us through the aging process. And so I like to think about managing this process through the concept of reframing. So you can see the little image there. Basically, reframing is a therapeutic term that takes the idea of, if you put a picture in one frame, and you take that picture out and you put it in a new frame, the picture looks entirely different. Now, the picture didn't change, right? But the frame did. The way you look at it changes. And so reframing helps create a different way of looking at a situation, a person, a relationship, and it changes its meaning. So the question is, how do I manage the things I cannot change? And it is by using the cognitive behavioral approach of using your mind to change the way you feel about it. It's accepting these are the things that I'm going with. Perhaps it's dealing with some incontinence. That can be very, very frustrating. I will tell you that every senior I have ever worked with in both genders almost always deal with some incontinence. Our bladder is just a muscle. And as we age, that muscle weakens. Can be very frustrating, and it can even be prohibitive at times of maybe activities that you once found enjoyment in. And so how do you work with that? Instead of fighting it and being angry and I can't believe this is happening to me, right? What are the things that you can do to manage that differently? To change the way that you intake fluids, to utilize clothing apparel that's available now, right? All of those different types of way to manage it rather than just being negative and hating it, which you can still hate it, that's fair, but can you work within it? because it's not going away. So that's that step of changing your mindset. Changing your mindset is the first thing you have to do if you even want to consider staying positive, or maybe getting positive again. Maybe you were once positive and you've had some things go wrong for you in your life or with your body. And so changing your mindset, look at it from a different angle. Look at it from a different frame. This is what it is. We're aging, right? The world is aging. People around us are aging. There is bad things happening around us, but we can accept that that's the case and then work with it. What are we doing to bring good to the world? What are we doing to impact other people in a positive way? What are other people doing in our lives to impact us in a positive way? Where is the good around you? You have to seek that out. It's easy to see the negative and can be hard to find the good. And so to seek that out, we're going to go to step 2, which is practice gratitude. So practicing gratitude is actually a practice. It isn't necessarily something that comes naturally for all of us. Now, I'm 44, so I'm pretty big in my smartphone use, and I use an app. It's called Thankful. If you're a smartphone user, download an app called Thankful. There are many, many practicing gratitude apps that you can use. If you're not a phone person or technology person, grab a notebook. And every night before you go to bed, write down 3 things that you're thankful for. Just 3 things that you're thankful for that day. Now, it doesn't have to be anything big or huge. The catch is we fail to think about the small stuff, the day-to-day things that we have access to that we can be thankful for. Being a thankful person is so much more positive than being someone who is not thankful, who's not noticing the good, who's not practicing gratitude. And I like to think of myself as a fairly positive person overall, but I do have to remind myself to practice gratitude. My app chimes at me every night at 7 o'clock. I have it set to give me a little ring at that time to remind me, hey, time for you to practice gratitude. And so I try each night to write down 3 things that I'm grateful for. Most often that looks like things like, air conditioning in our summer days, a pretty sunset. Sometimes if I get to sleep in, I'm grateful that I get to sleep in. I'm thankful. I was listening to something the other day and they said they were grateful for nutritious food and clean water. I didn't really even think of that. I take it for granted that that's something that I have access to. And so there's so many things. I'm thankful that I can still get out of bed in the morning. I'm thankful for whatever physical abilities I have, even if those physical abilities are diminished from maybe what they once were in previous years. And I'm thankful for relationships. I'm thankful for my family, for my friends, for someone that I get to talk to on the phone, for whatever it is. So I want you to just take a moment. I'm just going to give you a couple seconds and just jot down what are 3 things that you're grateful for just right now in this moment. So just take a moment and think of that. Okay, so practicing gratitude is step 2. Step 3 is to stay connected. Interact with others in meaningful ways and don't isolate. So this was one of the biggest impacts, I think, on our mental and emotional health from the pandemic was many of us were very isolated. That is so terrible for us as people. We are created for community. We are pack animals. We need each other. And so isolating yourself is going to decrease the positivity and the satisfaction in your life significantly. You have got to stay engaged with people. And in fact, in a lot of the research around happiness and around aging and a positive way, this is one of the number 1 factors, is people that remain in community. That's one of the goals of some of the residential communities that we have. They, independent living and assisted living and memory care, the goal is you're not at home alone. You have people around you, you have other residents around you, you have staff around you, you have activities happening. It's so that you're not isolated, because it's just not how it's meant to be for us. And so who in your life brings you joy? As we continue talking about this, jot these people down. Maybe this is just a phone call. One of my 90-year-old clients is in a residential community, and she has made some friends there, but her long-term friends are really special for her. She's lost a lot of friends now that she's 90, but she still has two very dear friends. One is local, but unable to leave her home because of her own illness, and the other is in Florida. And so time on the phone with them is very, very meaningful to her. They bring her joy. For many of my seniors, it's their family. Maybe grandchildren, children. Sometimes family is not going to bring you joy, and they may be the biggest source of non-joy in your life. Families are messy, but for many of us, it's family members that bring us joy. It's getting to, have lunch with, a son or a daughter or a grandchild, or even just sending emails or letters. So it doesn't always have to be that you have to be in the presence of other people necessarily, though I think that is best for most of us. It's that you're staying connected. So it's phone calls, it's writing letters, it's sending emails, it's whatever you need to do to stay connected with people in your life that bring you joy. And don't just talk about what's going on that's hard or bad. Right? That's really where a therapist comes in very handy, right? So I can say to my 90-year-old, you complain to me all you want. You have an hour a week, every week, to tell me all of your woes and all of the aches and pains and all the things that are hard, so that when you see your friends and family, you can just be with them. You can enjoy the time with them. That's the other benefit of a residential community as well, is that family members are no longer then responsible to provide caregiving services. Now, when you see your family members, you can just be with them. You go back to the mother-daughter relationship or the father-daughter relationship or whatever that relationship was, husband to wife, because someone else is dealing with the hard stuff, and you get to just be together and nourish each other. Activities with other people is really helpful. Sometimes talking is hard. Sometimes we have limitations in our talking, perhaps because of cognitive changes or dementia or illnesses that might cause us to have a difficult time communicating. And so activities can be very fun, from coloring together, adult coloring, you can also do puzzles. There are a lot of ways to interact. You can play games, card games are fun. Depending on what your interests are and the other person's interests are. Sometimes it's just going for a walk. You don't even have to necessarily be talking. Or maybe it's taking someone out to a movie, and whatever's accessible to you, right, and to them. Spending time with people. So make sure you have who in your life brings you joy. If you don't have anyone in your life that brings you joy, you should definitely give us a call, because we need to build more of a social system around you to keep you connected. And we can be one of those people to help, as does Elderwerks. Has quite a lot of opportunities as well. We run a book club with them, which is right now virtual. And we do that twice a month. And that's an opportunity to connect with other people and just have good conversations. That's another thing you can consider. So staying connected has to be intentional. And that is step number 3 for staying positive. All right. Step number 4 is move your body. So the best thing we can do is walk. So I looked up some information on what activity is kind of recommended. And so a somewhat active person usually walks 5,000 to 7,499 steps per day. A moderately active person is 7,500 steps to almost 10,000. And a very active is more than 10,000 steps a day. So 10,000 steps a day is what is recommended for all of us, for our heart health and for emotional health and wellness. There are days, I'm just being honest, that I'm not getting anywhere near 5,000 steps, much less 10,000 steps. Okay, that's okay. It's just about moving. Keep moving. Now, if you are still physically able, you can be doing more than walking. You could be cycling on a stationary bike. You could be participating in yoga or chair yoga. You could be going to your local senior center to do the exercises that they do. A lot of times, sit and be fit. If you are still very mobile and active, get to the gym and do workout classes. Do those for as long as you can. I don't know if you've heard the phrase, if you don't use it, you'll lose it. It's true of your body. Keep moving. Now, if you can't walk or you can't walk for long, do body appropriate exercises and range of motion activities. Okay, you can do a lot of exercises seated in a chair, using your legs and using your arms. You can do a lot of exercises laying in a bed or laying down on a couch or another surface. That's very often what's done in physical therapy. You know, if you're increasing your mobility, or if you've had an injury and you're now trying to rebuild strength, they're doing a lot of exercises from a chair or from a laying down position. Keep your body moving. Walk for as long as you can walk. If you can run, run. I don't run. Even though I could run, I don't know. I don't run. So whatever you enjoy to do, you need to keep doing. Even just stretching, sitting down and doing some stretches, stretching your back, moving your arms, all of that. It doesn't have to, it can be dancing. You can dance like no one's watching in your own house. There's no restrictions here as to what moving your body looks like, but you have to be consistent and committed to doing it. I don't know if you remember the law of, I don't know, it's a physics law, but it's things in motion stay in motion. Things at rest stay at rest. And I think you probably know this to be true. If you have a lazy day where you're just laying around all day, which is nice and you need to have sometimes, then you kind of don't really feel like doing anything. And the longer the day goes on, the more you don't feel like doing anything. But if you get up and you start moving your body, maybe you start your day with a short walk and get things going, you're more apt to keep going. Things in motion stay in motion. So whatever that looks like for you, you need to be intentional about doing that. It is so good for your physical health, but it's also really good for your emotional mental health, which, by the way, are completely interconnected. You cannot separate the two. When your body is not feeling good, you're going to be struggling mentally and emotionally. If you're struggling mentally and emotionally, it's going to impact your body. And so that means you can use both sides there to produce positive momentum as well. The other thing I would say, and again, I understand this is easy for me to say as a young person, walk with whatever you have to walk with to stay walking. If that means you're using a walking cane, okay. A walking cane is like having a three-legged stool. You now have something to help you keep your balance. If it's the risk of keeping your balance versus the risk of falling, keep your balance and walk for longer, because if you fall, it's going to prohibit your walking. So if it's a walking cane, use a walking cane. They have all kinds of different canes and pretty canes. And if it's a walker, use a walker. It's really just about staying mobile. If it's that you use a wheelchair, but you can sometimes push the wheelchair, then push the wheelchair if you can do that. If you can sit in a wheelchair and you can move yourself by pedaling your feet, move yourself by pedaling your feet. Whatever you can do to stay moving, to utilize those muscles to keep your body strong, that will help you with your positivity. Not only that, it helps you be able to do more things, right? So the more physically fit we are, the more used to moving we are, the more things we're able to do with our bodies. We have more stamina, we have more conditioning. So move your body every day. So what I want you to do is set a little goal for yourself. And now this isn't, when I say, take a walk every day, that can be a 5-minute walk. You can start out, walk down your block and back. Do that for 1 week. And then the next week, walk down your block, walk down the next block halfway and come back. And then the next week, do 2 blocks. And maybe that's all you'll do. And that's okay. If you can do more, keep adding to it. If you can do that twice a day or 3 times a day, great. Now, if you can walk 3 miles a day, so my best friend's father is 85 and he walks 3 miles every day. He has a goal that he wants to accomplish by the end of the year. And he does take days off for weather, but otherwise he's very committed. And because of that, he's in very good physical condition. Now, he doesn't have a chronic condition that would prevent him from doing that. He's blessed in that way. And so he's walking 3 miles a day. I think he probably could walk me under the table. I work out, but that can be very different from staying as active as I should be every day. Okay, so that is step 4. All right, step 5, seek enjoyment. Okay, try new things. Engage in hobbies. So with the people that I work with, these are all the things that I see that make a difference for them. Their mindset, their acceptance of the fact that we're aging and the fact that there may be chronic conditions that come with that, not only to mention the state of the world can sometimes be a chronic condition. They're staying connected with people in any way they can. They are moving their body in whatever way they can, and they are seeking enjoyment, trying new things, engaging in hobbies. The people that I see who struggle the most have nothing to do with themselves, and they have very few people that they're still connected with because they've allowed those relationships to just dwindle away. It's easy. If you can remember back to being in school when you're around your friends all the time, it's built in. Your friendships are built in. And as you age, you have to be more and more intentional about maintaining contact with your friends, setting up times to get together. And as we age and we're doing more doctor visits and we have more things wrong with us, then those things start to take priority. And which is why it's so important to continue to engage with people. And then, I forgot practicing gratitude as well. So those are the things that I really do notice a difference. The people that practice these things feel so much more positive overall. They're enjoying their time, even when sometimes it's hard because of the limitations that come with the aging process, but they still have meaningful relationships, they have meaningful activities. They're able to continue to move their body, even if they're no longer mobile. They practice gratitude, because they know this is what it is. We got to accept this and work with it. So I went through and just made a little bit of a list here based on some of the things that I know my clients like to do and thought this would give you some ideas. This is by no means a full list of all the things that you can do. This very much, of course, depends on your interests as well as your physical abilities. So one I see most frequently is gardening. And if gardening is something you love, I recommend getting a raised bed. These are things that you can now order online, no problem, or have your 6-year-old grandchild could probably order it online for you because they're so much better at technology than we are. Get a raised bed so that you don't have to bend over when you're gardening, and enjoy gardening. Get some tomato plants, get some cucumbers, get some flowers. There's no limit to what this can look like. Reading. A lot of people enjoy reading. And for some of us, if you have some cognitive decline, reading may not be as enjoyable anymore, then read shorter things. Go get a magazine instead of a full book. Flip through something that doesn't require so much attention or so much cognitive capacity to do. Writing, bird watching, walking, of course we talked about, and exercise, genealogy. So again, my best friend's dad, the other major interest of his, he does the 3-mile walks a day, and he is very into genealogy. And he does this now for other people. He's actually done some family tree stuff for me with my family, and he's helped a couple other of his close friends, and he loves it. It's just right up his alley. He can spend hours and hours researching this and making the connections and seeing the history. You do have to be a little computer savvy to do it, but it doesn't take too much to pick it up. So genealogy is good. Any type of needlework, so knitting, crochet, sewing. So when I first started working with seniors, I was in my early 30s, and I was very involved in adventure sports. And the more I worked with seniors, the more I realized I need some hobbies that I can sit and do. Even now, what if I break my leg? Right? I won't have any hobbies to do because all my hobbies were very active. And so I took up quilting. I love quilting. I've since made 8 quilts, and I make them for people that I care about, my friends and family. And I picture that person and what they would like, and I design it, and I pick up the colors, and I sew it on my sewing machine. It's the only thing I know how to sew because quilts they're just squares that you just sew together. I could never make clothes or anything like that. I love it, and I will maintain that hobby, Lord willing, for many, many years. Crocheting and knitting. I also learned how to loom knit. I can't actually knit. I don't quite have the coordination to do that, but I've made a lot of scarves for people. My mom really enjoys cross stitch. There was a time when she was starting to feel very bored and didn't know what to do with herself and just felt like she kind of ran out of hobbies. And so she took up cross stitch, and she was probably 65 at the time. And she's made us all some really wonderful things. I'm actually sitting with one of the pillows that she made me. I'll show you just for fun. So you can make things for people. I love that I have something that my mom made me. So word search and crossword, a lot of people find that really engaging and enjoyable. Puzzles, building models. So I have a client who, those are his two favorite things. He builds models and puzzles. And sometimes, you know, he does cars or planes, and he does model kits, and sometimes he does them custom. And that's really fun. Singing or playing an instrument. Let me say this too, music is so good for your brain. So anything you can do with music is good. Listening to music, dancing to music, singing. If you play an instrument, go back and play that instrument. Even if you can't read music anymore, if you can tinker around on it, even that is good for you and good for your brain. Painting and drawing. I have quite a few artists that I see. I actually have a painting hanging in the room I'm sitting in from one of my clients who does beautiful oil work. And so she actually at, I think she was probably about 86 at the time, went back and started taking a class again just to have the guidance and the tutoring to continue painting. She's always painted. She's a wonderful painter. I, on the other hand, am not a good painter, but if you are, you should be painting. The other thing you can do is just paint for fun. We now have adult paint by numbers. You can order that very easily online, or someone can order it for you. And that can be very fun. Drawing, any kind of crafting, making wreaths, making Christmas decorations, anything. I recently, and I did this, but I did this with my aunt. My aunt is in her 70s, and we found something about using placemats from the dollar store to make holiday pillows out of. And so we both saw it, and we both ended up doing it and giving each other a holiday pillow for the holiday. We didn't even know it. But so we went and got the mats from the dollar store, and we stuffed them, and then I sewed mine using my machine, and she sewed hers by hand. And that was the gift that we gave each other that holiday. Very fun. Golfing. If you're a golfer, do that. Go to the driving range, rent a cart if it's too hard to walk all of that. Dancing, swimming, any kind of water is really good. Water aerobics, moving around in the water, just walking in the water takes all that pressure off your joints. You can even use a floaty so that you don't have to worry about, tripping or falling or getting under the water. If you have the mobility, you should definitely take water aerobics. It is very, very good for you. And actually, you'd be surprised at how hard it is, but in a good way. Listening to music, we talked about, watching movies, coloring. We now have adult coloring books that you can purchase. We have adult coloring pages that can be printed out online for free. Photography, online learning, jewelry making, scrapbooking, origami, fishing, astronomy. There's so many things that you can do to enjoy yourself. And they may need to look different. Maybe in your earlier years, you were doing ballroom dancing, and now the dancing that you do is just shuffling around in your kitchen. That's okay, right? We are accepting the limitations that come with aging, and we are learning to work within those limitations. So just like I made that decision in my 30s, really before I was limited by my body, I said, I got to learn to do some stuff that if I become limited at any time in my life, I have hobbies, things that I enjoy doing, and things that bring me enjoyment and relaxation. So this is just a list to give you some ideas. And what I want you to do is just circle any of them that interest you. Well, I guess you're on the screen. So write any of them down that interest you. Write any down that you already do. Decide if you need to do more of that thing, whatever that is. Or if you need to try something new. So that is one of my really values in life, is I seek to try new things. Sometimes it sticks for me and sometimes it doesn't, right? I tried the regular needle knitting, didn't really work for me, couldn't do it. That's okay. I tried the adult paint by number. It's very, very detail oriented, and I tend to be a little bit more get it done faster. So didn't love the paint by number, but I really like the adult coloring. Very relaxing. And I love using colored pencils for that. Something about the way the pencil feels. Okay, so try some stuff. If you've never done jewelry making, try it. If you've, never done photography, try it. You got nothing to lose. So seeking enjoyment. So that finishes us off. This is my contact information if you'd like. Let me go back to our first slide if I can here. Sorry about that. Just to put these 5 steps back up. Okay, so 5 ways to maintain your positivity. Change your mindset. Okay, being positive is a choice. And so you got to start there. You got to start with, this is an option for me. I can feel better by the way that I use my thoughts. I can make myself feel better. You already do this naturally. Okay, we already use our minds to impact how we feel. When we're being negative, that is your mind. You are thinking thoughts. You are thinking, oh, I can't get out of this chair anymore, and my knees are killing me, and I don't want to deal with this anymore, and so-and-so just made me mad, and I can't do this or that. That is all going on in your mind. You got to take that, I call it your superpower. You got to use that superpower for good instead of evil, right? Just like our superheroes and our supervillains, you got to use it for good. So start thinking positive. Practicing gratitude, that will help you think positive when you remember daily all the things that you have to be thankful for and all the little things that we take for granted that we still have. Practicing gratitude, staying connected with friends and family, loved ones, meeting new people, moving your body in whatever way that looks like for you, and then seeking enjoyment. Find hobbies, do things you love. For my grandmother, she has always loved movies. She's now 90, she just turned 90, and she does have dementia. She still loves movies. And during the pandemic, my mom, who is her primary caregiver, since we didn't have the option of going to the theater, they would rent a movie on, the TV and pop popcorn and get soda and make it a movie night at home. If her mobility decreases, that's the same thing that would happen. We would do that at home. When her mobility is good, we take her to the theater. She has loved going to the theater for her whole life. Okay, seek enjoyment. Those are the things that matter. If you have any questions, I will be here to answer those.
Hi. Hi, Cori. Can you hear me? Can you see me? Okay.
I can see you.
Oh, you can't hear me. Oh,
Hi.
no. You can't hear me at all? Oh, okay, good. I was like, uh-oh, we're in deep doo-doo. We've had some issues in the past, so, So I liked your presentation. Thank you. It was good. We don't have any comments, but I have some because, I always do. I find you very engaging and happy, and that helps my happy. And what I want to just say is negativity breeds negativity. If you want to be a happier person, surrounding yourself with good, happy people helps, right? So I know that, your best friend might be your best friend, but maybe she's a doggy downer. And maybe you just spend a little less time with her because you need to protect yourself, right?
100%.
I know,
for sure.
No one wants a doggy downer. I know my daughter always complains to me because people are like saying to her, you should smile more. You have a pretty smile. And she's like, I don't want to smile. Leave me alone.
And actually, they say if you're not feeling all that great, you should smile because the act of smiling even makes you feel better.
It does. I agree. I smile all the time. And you know what else I do? I tell myself stupid jokes and I make myself laugh all the time because I'm crazy. Well, that's a bad word, but I like to have fun. Yes. And so, yes, my family laughs at me because I'm always laughing at myself.
Good.
So a few other items. I love that you quilt. I didn't know you quilted.
I do. Mm-hmm.
I don't know how you do that.
I'm a newbie still, technically, but
you like it.
I love it. I took a class. I went and first I had to take a sewing class so that I knew how to use a sewing machine.
Oh gosh.
And then I took a quilting class, and actually because it's all squares, once you know how to use a machine, it gets easier. And the more you do it, the more creative you can get with it. So I do.
But you took a class.
I did take a class. It was only three sessions.
Nice.
At there's a place in Palatine that does it. And nice. And then I have several friends that do it. So if I get stuck, I can call them.
See, that's good socialization too.
Yep.
So let's see here. Some of the things that I thought of is I like to organize and declutter when I'm bored. I know most humans don't.
I do too.
It brings me happy. I love it. When I'm done, like, yeehaw. My house is always clean though. Cooking, right? We've heard cooking.
Yes.
And baking. My daughter bakes.
Baking.
When she's depressed, she bakes. So I know when she's depressed because I get fat.
Yep, those are good ones too.
Making myself laugh.
Yeah.
I am such a good fall. Anyway, we don't have many questions, but I love this presentation on happiness because there's so much negativity in the world, and these people, I am one of them. We go and we try to find socialization where we can, and if we're at home, one of the things they do is go on Facebook, and I find that Facebook's very negative. Mm-hmm. I try to limit myself on there. In the mornings I go on, and after work I go on because of my business, right? Just because of that. And I like to see the baby photos and the animals. My happy part is I only look at the happy dog and cat postings, like the animal postings. They're fun. But if they start showing the sad things, I'm skipping. Don't read them.
No, I don't read them. I joined a bunch of, dog and cat groups and happy, fun. Yeah, you just need a little dose of happiness. And so, I joined all those groups too. And I just love seeing all the puppies. And sometimes I'm like, that's it. I just need puppies and kittens and rainbows, nothing else. Life is too hard.
It's true. It's true. If you need a little happiness, join one of the groups that gives you happy, not these depressing groups. Don't go in the grumpy pants groups or the ones where everybody complains or, the bridge is out again, or there's coyotes in my backyard. Who cares? Right. Look at the ones that really are going to bring you some enjoyment, right? Mm-hmm. So that's the same with TV, excessive TV watching. That's not bringing you any happy or exercise. Mm-hmm. So what do you think? What do you think about that? People who watch more TV than get up and do.
It's such an obvious difference to me because of the population that I work with. To compare, I mean, what I said in the presentation is literally the people who are aging well are the people who are moving, who stay connected with people, loved ones, and who are, practicing gratitude and have hobbies. When people just sit and watch TV, even if it's like positive TV, right? Like it's not even necessarily like the news. It could be like HGTV or the History Channel or something they enjoy. While they're just sitting there, they're just declining. It's not positive. At best, it's neutral. And at worst, it's negative and causes a decline in mental and physical health.
Yeah, I think a lot of us, and TikTok too. Whoa. Okay, so for those who don't know what TikTok is,
I think you might be talking to the wrong group about TikTok.
TikTok is basically snippets, little videos from all over the world about all sorts of subjects. The problem is they suck you in. So let's say you get on your first time on and you are depressed and you looked at something bad, like you looked at a car accident or you looked at an animal dying. Well, guess that feed is going to continue to feed you that. That's the problem. It feeds you only what you've looked at and what your interests are. So if you're on TikTok and you want to be on TikTok, you need to only look at videos and mark the ones you like that are fun, engaging, happy, educational, and skip the other ones, because otherwise all it feeds you is that negativity. Oh, negativity. And then you need Cori. Pretty much. You need Cori at that point. This is hard to get out of. I don't get on TikTok.
I'm not on TikTok. I don't. No. I limit my Facebook and Instagram are my only two social medias, and I limit those to puppies and kittens and updates from friends and family that are out of state.
Yeah, and I mean, it is a good way to connect with family out of state. Honestly, going on Facebook and looking at your family's photos and what they're doing, that's great, but that can also still depress you because they're not local to you and you're not seeing them and interacting. So be very careful of what you're doing, right?
Yeah. You're also only getting part of the story of everyone's lives. So while you see your family members looking all happy and wonderful at a party, don't forget that there's usually family drama associated with that. And, we only see the good side on Facebook.
Oh, yes. Most people don't post the, this was the worst vacation ever. They show pictures of them happy on the beach. They don't show them losing their luggage or breaking their toe or getting bit by a lobster or whatever.
Yeah. Yeah, exactly. And I think you forget, like I posted last Christmas pictures from my family. I went home for Christmas. I have a very big family. We get together for the holiday and it's generally a good time, but it's because we're together for 3 days. And if we were together for 7 days, my Facebook feed wouldn't look the same as it does. And someone said, wow, your family looks so idealistic. And I was like, oh, well, should I have said this and that this happened and that this happened? I forgot to mention that on social media. Sorry. Yeah. We're a lot of love with a lot of issues.
And the problem with humans in general is we know our lives, right? And then we see whatever's posted, or we see our friends, or we see our neighbors, and the grass is always greener. That's just how it is. The grass is always greener. It's not. There's dead grass over there. Don't go over there, because your life is your life and it's good. And if it's not good, you have to change it. No one can change it for you. No one made this happen to you. I mean, bad things could have happened to you, but you need to pull yourself up by your bootstraps and say, I'm going to get some happy back, right? I'm going to do what I can to find my happiness. And I had 1 year of depression, as you know, with Cori. I didn't seek counseling. I talked to everybody and their brother. Everyone, all my friends, all my business associates, everyone knew what was going on in my life, because that's my way of communicating. Not necessarily was good for everyone receiving that communication. They
might have been talking to me.
Yeah, they probably thought, wow, Jennifer, she is off the rails. I really don't want to be around her. Negativity, negativity, negativity. But for me at that time, that is what I needed. And they were really good at listening. And I didn't just dwell on it every single time I saw someone. So that was good. But talking with people is extremely important. If you don't have people you can talk to, honestly, Cori's a great listener. And in my own family, I have referred to Barrington Behavioral Health and Wellness. One of your counselors talks to my daughter, I think weekly. I don't know. She doesn't tell me because it's private. But my daughter has some mental health challenges, and Barrington Behavioral Health has been awesome in helping her through those. And they basically have supported her and her needs versus the mom. I'm the mom. I can't always fix things. Most of the time I can't, because I don't know that world, honestly. I am not my daughter. I am a very happy, positive person. She has this issue, and I've never really experienced it except for the one time. So you really cannot understand what your loved one's going through. So if you have an older adult, you have a parent or a grandparent or an aunt or an uncle, a sister, daughter, whatever, and you know they're struggling, there is nothing wrong with talking to a professional. Nothing. And if you're a man, accept some help, for God's sakes. I'm sorry. Just because you're male does not mean you don't need to talk to someone, right?
It's true. I actually see quite a few older men.
Good.
And it's really great. It's really great because you've been culturally, we've said you're fine and you don't have to, you don't have feelings and you don't have to talk to anyone. And you do. You just need some support and help. And it's not even I think we think of counseling and therapy. It's really just, I love seeing my own therapist because I can just vent. I can say all the things I'm thinking without judgment. And she gives me helpful tools. I'm a therapist. I know the tools. But in my own life, I need to be reminded,
part of the introspective.
Right. Choose to use this tool and choose to look at it in this way. And she helps me reframe things. And it's just helpful to have an outside perspective and someone who's not in your family that you can say anything you want to and support.
You're right. And my daughter always says I'm judgy, and I never, ever mean to be. I don't think I'm being it. And I honestly don't even know I'm being judgy. And I'm a work in progress.
As
not gonna lie. I say things all the time that are stupid because everything I think comes out my mouth. So therefore, we have some issues.
Yes, filters are positive.
What's that? What's that filter thing?
What's a filter?
So good news, everybody. Everyone's a work in progress. Everybody needs help sometimes, maybe all the time. Doesn't matter. If you're trying to make yourself the best you can be, all's well in the world. And you have to take care of yourself. Cori, you're fabulous. I love your team. Do you have any final thoughts before we go?
I don't think so, no. But thank you. We love your team as well and partnering with you. And
thank you.
Thank you. You give.
Thank you. And Barrington Behavioral Health and Wellness does have offices in Palatine and Barrington. And they also can see folks at the Elderwerks Center in Palatine if you want a neutral space. We are not judgy here at Elderwerks. We just judge our own families, which is really bad. So we have to work on that. But Barrington Behavioral Health is available. You can call Elderwerks, Barrington Behavioral Health and Wellness. But just reach out when you need help, because taking care of yourself is hugely important, especially if you're taking care of others. You need to do some self-care. So thank you, Cori. You're the best.
For sure.
Thank you. We'll talk to you later.
Thanks.
Bye.
We've helped thousands of clients secure and maintain a quality of life that suits their personalities. As the population ages and demand for senior services increases, Elderwerks will be there, offering more learning opportunities, activities, fun, and support. Aging well and planning for future needs can be easy if you call Elderwerks 847-462-0885.
This is Jackie.
Hey there, everybody. It's me, Jennifer. If you don't know who I am by now, you haven't been watching. I just wanted to let everyone know that our Stepping Out to Fitness program that we've been running through the summer was very successful. We had so many people keeping fit. It's quite impressive. So I just want to let everyone know we're going to be doing it again in January for 3 months. So people will have the opportunity to document whatever exercise they're doing, physical therapy, anything to get you out of your chair is good for us. So if you are in a wheelchair, if you're using a walker, a cane, you do you. Whatever it is that you need to do to get up, get some exercise, get some socialization, any of those things would be fantastic. So we will be having prizes for winners January, February, and March. And then at the end of the March, if you participated in January, February, and March consistently, you get to go in a drawing for an Apple iWatch or a flat screen TV. We're thinking you'd like the Apple iWatch because it's a fantastic tool. You can use it to, look at your heart rate, actually keep track of your exercise, and it can also dial 911 should you fall. So it's a very good product. I just wanted to insert that before we get to our next fitness person. Our next person is Julia. I can't say her last name. We'll call her Julia T. She's really, really adorable, very nice. She is an exercise guru, and she's going to basically help you do stretches to keep the body moving. And this class is fantastic. So hopefully you're going to be doing some of the stretches with us. I have attempted to do some of the exercises that have been on, but it's really hard to exercise when you're typing. So I haven't got to do many of the exercises, but thank you so much for following along this week. I know it's a lot of programming. If you miss any of the presenters or classes, you can always see them later on our website. We're going to be having them available on our website, as well as on our Facebook page and our YouTube channel. If you have questions ever about this entire expo or anything else, you can just call us at 847-462-0885, and we're happy to answer any questions you have. We're very easy. We sell nothing. We're a complimentary service. We're just here for you. So please call us. I'm going to go ahead and get off now, and I hope that you enjoy the rest of the afternoon. Be safe. Bye, guys.
Pilosoff from Home Care Assistance. We are a non-medical caregiving agency that provides caregivers to seniors to allow them to stay living in their homes with the best quality of life possible, staying social, exercising their brains, and of course, staying physically active. So it's time to get fit. Please welcome Julia, a local business owner who is the owner of J2 Massage, a therapeutic massage practice. Julia is involved in the local community as a member of the Palatine Chamber of Commerce, as well as a co-chair of the Women in Business Advisory Forum. Julia's love of massage has given her the ability to work with both children and adults, providing massage services for over 12 years. Julia enjoys working with people and helping them achieve their physical goals. So let's go. Time to get fit. Enjoy.
So today we're going to learn a little bit about stretching. Some of these are super simple stretches that everybody could do at home, and you could do them while standing or sitting. So what a stretch is a type of exercise that you could do for your muscles. It helps to open up the muscle, improve circulation. It helps to improve range of motion, mobility, it reduces stress, and it prevents injury. So Kathy's going to be sitting in a chair doing stretches with us. We're going to start with stretches from head to toe, and each stretch should be done about 3 to 5 times depending on the stretch, or it should be held for about 8 seconds so that your brain can get the information and send it back to your body. So we're going to start with some simple neck stretches. We're going to point our chin down towards our chest and count to 8. 1, 2, 3, 4, 5, 6, 7, 8. And we're going to do the same thing when we lower our head as close to our back as possible and look up at the ceiling and count to 1, 2, 3, 4, 5, 6, 7, 8. All right, so the next stretch we're going to do is we're going to pick a point that we can look at, and then we're going to extend our chin towards that point and then pull our shoulders back and count to 1, 2, 3, 4, 5, 6, 7, 8, and we can relax. And then we're gonna do some more neck stretches. We're gonna tilt our head to the side. We wanna make sure that we are not lifting our shoulder when we are trying to do this. So if you're gonna look at Kathy and I, we're just tilting our head and we're gonna count to 1, 2, 3, 4, 5, 6, 7, 8. And now we're gonna switch sides, and we're gonna go to the left. 1, 2, 3, 4, 5, 6, 7, 8. So the next stretch we're gonna do is I'm gonna step away from Kathy so we could give each other space. And we're gonna extend our arm out, and we're gonna tilt our head to the side. And then we're gonna pretend that we're reaching for something that's really, really far away. I'm gonna start with doing small circles until we make the circle bigger and bigger and bigger while we're still extending our arm out. And then we're gonna reverse the rotation and make the circle smaller. I'm gonna stand behind Kathy so that you can see my left arm as I do this. And we're gonna extend our arm out and tilt our head and start with a small circle and make the circle bigger and bigger and bigger, and then reverse the rotation and make the circle smaller. I'm gonna correct Kathy's arm while she's still in this position. We wanna make sure that the palm is up as much as possible. Thank you so much, Kathy, for demonstrating that for us. So the next stretch we're gonna do is we're gonna place our arm at a 90-degree angle, and we wanna make sure that the shoulder and the elbow are as close as on the same parallel line as possible. So we're gonna take our arm and we're gonna tilt it down. 1, and we're gonna lift it up. 2, and 3, and 4, and 5. We want to make sure that we do stretches on both sides to make our bodies equal, because if we only stretch one side and don't stretch the other side, we might make that side tighter. Also, don't get discouraged if you're not able to do the stretches all the way. So if you're only able to bring your arm here, stop, go back up, and repeat. And with each time, you should be able to get your arm a little further down. So we're gonna do another stretch from this position. We're gonna wave. Bring our hand to the head and take it out to the side. Bring our hand to the head and take it out to the side. And 2 more. 1 and 2. And we're gonna tilt our arms down, and we're gonna go and wave on the bottom. And once we're all done, we're gonna do the other side with the wave. 1, 2, 3, 4, and 5, and 1, and 2, and 3, and 4, and 5. If you feel to, you can shake out your arms, and then we're gonna do some shoulder rotations. So we're gonna bring our shoulders and rotate them backwards, and then we're gonna rotate them forwards to relax our shoulders. We're gonna do some more arm stretches. So we're gonna take our arm and we can either pull on our elbow, but if we can't reach our elbow, don't get discouraged. If you look at Kathy, she's using her wrist, and pull, and 2, and 3, and 4, and 5. And we're gonna do the same thing on this side. And 1, and 2, and 3, and 4, and 5. All right, so we're all gonna do a prayer stretch. So we're gonna place our arms in front of us. We want them to be right where our chest area is. And then we're gonna take our arms and take them out. 1, 2, 3, 4, and 5. All right, so the next stretch we're going to do is something that everybody's familiar with. We're going to take our arm and pull this way. And we're going to hold it for 2 more seconds. And we're going to let go. I'm going to switch. And relax. So we're going to do a stretch that I do with my kids that I teach. So we're going to do a stretch that starts with antlers. And your goal here is to bring your elbow as close to your rib cage as possible. If you're not able to do it equally on both sides, that's okay. Like I'm tight around my left, so I'm not able to bring it as far down as I am able to do it on the right. So we're gonna start with antlers, and then we're gonna do chicken wings, and then we're gonna break the chicken wings. And we're gonna do this one more time. And if you do these stretches against the wall or on the floor, you can also do that. But you could do them in the chair or while standing up. If you've had a really long day at work and you need to stretch, or you've been working in the garden or golfing, these are excellent stretches to get your mobility in the shoulder area. So we're gonna do another stretch for the pectoral muscles, for the chest area. And here we're gonna make 2 fingers into a little bunny. And then we're gonna start in the middle, right where your clavicle is and your chest meet. So, and we're gonna start doing circles all the way from the inside, going out. And once we get to the division where the arm and the shoulder meet, we're gonna make a little saw and extend our arm out. So, and then we're gonna bring our arm in while holding our fingers there. For some people, we may only need to do this once because their area here is smaller, but for other people, like a bigger gentleman, you would have to go all the way from the top to the bottom until you get to your armpit area. So 1, 2, 3, 4. And we're gonna do the other side. We're gonna do crawl along the clavicle, doing circles. And then we're gonna get to this portion and we're gonna go 1, 2, 3, 4. So Kathy's sitting down and I'm standing up, but you could do the stretch even when you're sitting. So we're gonna have Kathy lean forward when she does. So what you're gonna do is you're gonna take your thumb and fingers are gonna go on the inside of the armpit as the thumb goes on the outside of the armpit. And what we're gonna do is we're gonna lean forward, and that way you'll have the whole muscle in your hand as you stand up, and you can squeeze here. And if you do that, you will actually feel like the muscle is melting underneath your fingertips like butter. It helps to open up this chest area, especially if you're working at a desk, or sitting and typing emails. So it really helps to relax this area. You could do the same thing for the back muscle right over here, and by placing your thumb in the armpit and your fingers wrap around the muscle right here. And we're gonna lean down, and then when we stand up, we'll have the muscle right in our fingertips and we can squeeze. And we can do that for the other side. So fingers in the armpit first and thumb on the outside, and lean down so we're able to grab the muscle when we stand up. And when we squeeze, it should feel like butter melting underneath your fingertips. And so we're gonna do the same thing for the back. Thumb in the armpit and fingers on the outside. Just drop down, and when you roll back up, you should be able to hold the muscle and it will be melting. Sometimes when this area is tight, it can affect our arm right here, and it can be painful to even reach over. So if we work right here, we'll help our whole arm relax. So we're gonna do another forearm stretch. So we're gonna extend our arm out and bend our fingers down. and we're gonna hold it for 1, 2, 3, 4, 5, 6, 7, 8. And we're gonna switch arms, palm down, and we're gonna hold it for 1, 2, 3, 4, 5, 6, 7, 8. And so another forearm stretch that's really good for carpal tunnel, especially if you're using your fingers, and we're gonna find the division in between the two muscles right over here in the center, and your fingers go right up on the top. And then you're gonna rotate your arm down as you squeeze. Rotate down, and then you're going up with your other fingers. So you're moving on up on your forearm until you get to your elbow. So we divided the two main muscles. We're gonna work on each finger individually. This is a really good stretch. You're gonna keep your thumb in the same place, but you're gonna take your fingers from the pinky and you're gonna find where the pink muscle of the pinky is. Thumb on the same spot, and you're gonna do rotation down as you work on the pinky. And then the same thing for the ring finger. And then for the middle finger. And one last one for the pointer finger. All right, and we're gonna switch sides just to make sure that everything is equal. So thumb in the center, fingers at the top, and rotate down. And now the ring finger. I know this may look very simple, but it's very effective. And then we can always shake our arms out to get better circulation. Okay, so we did a lot of upper body stretches, so we're gonna do some torso stretches. I know a lot of people do this whole thing where they're stretching like this. That's really good, except they're doing it really fast. So what we're gonna do is we're gonna place our hands right here, and then we're gonna do a stretch. Yes, as Kathy demonstrated, she moved a little bit forward on the seat, so she would have a little bit more motion as she's doing it. So we're gonna place our hands here, and we're gonna do a twist, and we're gonna hold it for 8 seconds. 1, 2, 3, 4, 5, 6, 7, 8. I know some people may feel like they have tension right in here when they do that. That's okay, because your legs are moving too, even though you're just moving the top of your body. So we're gonna place our hands here, and we're gonna turn the opposite direction and go 1, 2, 3, 4, 5, 6, 7, 8. And we're gonna go breathe out. All right, so we're gonna do these side stretches, which are really good for your oblique muscles, okay? And you could do them while standing up or while sitting down. So the goal here is to make sure that your arms are not going out from your body, that they stay connected to your body. Okay, so with one arm, you're gonna slide down, and while the other arm goes up. So I'm gonna help Kathy just so we can do a little bit of a better demonstration. So the further she actually brings this arm up, the more of a stretch she gets on the other side. And so we're gonna switch sides and see how does that feel. So I'm gonna show you while standing up. So this arm goes towards the knee, and this arm goes towards the armpit. And you're getting a really good side stretch. It's good for your side oblique muscles as well as your lower back. So if you ever feel like your lower back is hurting you, this is a great way to start stretching. It's not very invasive because you're not required to do a lot of work here. So you can always roll your spine forward as well. So when we're gonna do this as slowly as possible. Kathy's gonna be sitting down. I am gonna ask her to move back just on the seat just a smidgen. And she's gonna take her palms and we're just gonna slide them down our legs. If you get to a point where you feel you can't go any further, that's okay. Get to that point, stay there for 1, 2, 3, and then slowly roll back up. And we're gonna do this 2 more times, okay? We're gonna go down. And we're gonna go up. And we're gonna do this. Going down. And going up. So we're gonna have Kathy stay in the seat, okay? And we are gonna show you some stretches that you could do for your lower back. If you're able to do them, if you're not able to do them, that's okay. All right, so we're gonna have Kathy do some more stretches for us while she's sitting down. So these are lower back stretches, and if you're not able to do them, that's okay. So we're gonna have Kathy take her leg out in front of her. All right, and now I'm gonna have you lean forward. How does it feel?
Okay.
And we're gonna hold it for 2 more seconds, and then she can relax. And then she's gonna lift her other leg up. We wanna make sure we do both sides and lean forward for us. All right. So, Kathy, can you cross your leg over for us? Awesome. And now I want you to lean forward again, because you're stretching 2 different muscle groups. It may not seem like much, but there are different muscles in your glutes and back that help you do this stretch, and we're gonna switch sides because we don't wanna hold this stretch for too long. And we're gonna lean forward 1 more time. Okay, so we're gonna have Kathy relax for just a second. And so now Kathy is gonna cross her leg over 1 more time, but she's gonna do something different. So cross whichever leg you pick first. And what you're gonna do is you're gonna pull your knee towards you. Okay, do you feel a stretch when you do that? Mm-hmm. And relax, and we're gonna switch sides. And if you feel like you need help doing this one, don't hesitate to push yourself further. So if Kathy's holding her knee, you can also move your arm up and hold your thigh, okay? So Kathy can relax. All right, and now, Kathy, we're gonna do some calf stretches. So what you're gonna do, you're gonna extend your leg forward like you did before and point your toes up towards you. And we're gonna hold that for 1, 2, 3, 4, 5. And we're gonna do the same thing on the opposite leg. 1, I can only do one side, so I'm not holding on to something. So now nobody's perfect. So 1, 2, 3, 4, 5. Thank you so much for participating with us, Kathy. We're gonna show you some other stretches that you may do while you're standing on. So we're gonna do some other stretches that you can do while holding on to a chair. One of the stretches is really good for your pelvis and your lower back. It helps the rotation in the hips, especially if you've had any kind of hip injury or hip surgery. This opens up those little muscles in the inguinal area, and it helps you walk and it helps you lift your legs up, so it's really beneficial. It's really super simple. So you can hold on to a chair with one hand, and you're gonna take your other hand and place your fingers right where the hip is, right over here. And you're gonna take your thumb and place it right here on the glute. So you're kind of grabbing your whole hip while you're doing this. As you're holding on to the chair, you're gonna do rotations going out and rotations going in while holding on to that area. Because you're preventing those muscles from moving as much, it will really help. So you could do that on the opposite side as well. You are gonna do I'm gonna move the chair to the opposite side. And you're gonna do a rotation going this way and a rotation going that way. So this is another leg stretch. It's a little bit more complicated, but it's not that difficult. So what you're gonna do is you're gonna stand on one leg. So holding on, I'm holding on the left. I'm using my right leg to stand on. And what I'm gonna do is I'm gonna actually sweep my other leg underneath. So what I'm doing is I'm just crossing my leg and bending down. And it helps to open up that hip area. And you're gonna bend down while you're holding on. We're gonna show you how to do this on the other side as well. You're gonna, in this case, I'm holding on with the right, so my left leg is the one that's my stabilizing leg, and I'm crossing over and bending down. And if it is a little bit difficult on your knees, don't hesitate and just skip this step altogether. We're gonna do a calf stretch. I know Kathy demonstrated for us a stretch that you're able to do for the calves on the chair. We're gonna demonstrate it while you're standing up. So if you're out and about and you feel like your muscles are cramping up or you feel some neuropathy affecting your feet, you can always find a chair or a wall. Make sure that your shoes are flexible or that you're barefoot, because it works better that way. So you're gonna place your foot on the surface and then you're gonna lean towards it to stretch that foot and calf. And you're gonna hold it for 5 seconds and let go, and you're gonna switch feet and do the other one. And you can always hold on to something so you don't feel like you're losing your balance. So we're going to demonstrate some simple 2 stretches that you could do on the floor. These are really good for your lower back. You could actually do these in the bed, but we prefer you do them on the floor because it actually helps the spine to be more straight. However, I know that some people who suffer from sciatica and have a hard time getting out of bed in the morning, these are excellent to start with. So I'm gonna lay down on the floor. And if I wake up and I'm feeling like my muscles are super tight and I can't move this portion of my body, my goal first is to bring my knees up, and then I'm going to try to bring my knees as close to my chest as possible and just pull on my knees. I'm going to hold this for 5 seconds. And then I'm going to put my legs down, and you're going to do all of these very slowly. And then while keeping the legs in the same position, I'm going to bring them up, and then I'm going to tilt them away from me. And you should be able to feel that stretch in your lower back. You could go even further if you'd like, but just a little stretch is good enough. And I'm going to put my legs down, and I'm going to bring them back up, and we're going to go to the other side. If you need to stabilize yourself, you could put your arm out, and then you're able to move your legs even further. And then you're going to lean back and lower the legs. So in this case, we're going to do one leg at a time. So I have a towel here that I rolled in, so I would have some control over my leg. So what you're going to do is you're going to place the towel right underneath the knee, and you're going to pull your leg as far as you can, and then you're going to take the same towel without moving your leg as much as you can and push. So your goal here is to pull and push, to pull and then push. And this helps to release the muscles in the lower back. So I'm going to do the same thing on the left leg. So I'm going to put the towel right underneath my knee and pull it as close as I can to my chest. And then put it on my foot and push. And when you're pushing, I want you to use your heel, not your toes. So if your toes are sticking out, that's good, because we want you to use that heel. And you're going to push with the heel instead of the knee and the toes. So, and you could pull and then push and then pull and push. You could also use the towel to open up the leg right over here. So we're gonna have you place your towel right over here, also below the knee. And you're gonna pull your leg out. And 1, and 2, and 3, and 4, and 5. Hopefully all these stretches help you feel better and get more relaxed. Thank you so much for joining this class and participating with us. If you have any questions, I'll be more than happy to answer.
Hello, Julia.
Oh,
there you are. I was watching your exercise. I really enjoyed the towel one.
It's a really good exercise, and it doesn't seem like it's something that's, going to make a difference, but when people do it, it actually helps you stretch quite a bit.
I think it's good for stretching because, I usually just grab my foot and pull, which probably is not as good or safe.
And, not everybody has bands at home. So when we use a towel, everybody has a towel at home that they can use. And that's something that's very accessible.
Oh, that's good. That's good. Do you have any tips for, like, I'm going to tell you, 6-foot male who doesn't know how to touch his toes or can't touch his toes to stretch without hurting himself?
So the sideline stretch that I showed earlier, where you put your hands at the sides, that one is super helpful. Even though that you're not reaching for your toes, but you're stretching at the sideline, it opens up that whole lower back area. So if he does any of the stretches that we showed for the lower back, it really helps tremendously.
Yeah, I'm going to have him do that.
Be very stubborn and not want to stretch. But we encourage stretching because that's what prolongs our life and opens up the muscles and provides circulation and blood flow into the muscle region.
Yeah, I think it also helps with your demeanor. Grumpy pantses, right?
Yeah, because it brings positive hormones. And we, in the previous presentation, we talked about happiness. So when we stretch, it actually brings positive hormones into our body and helps our body to become stronger and happier.
Well, who would have thought we had happy hormones?
We have plenty of happy hormones, and that's what actually makes our muscles function is the happy hormones.
Excellent. Excellent. Well, I was looking on here to see if there is any questions. I don't see any, so I'm just going to keep asking them because that's my thing. I guess every day I ask questions. Inquiring minds want to know. So for those that have limited mobility, I know you do work on that. So we'll just use my husband because he's a very good guinea pig. He has compressed discs, and he's been doing planks to try to strengthen his back. But if he does something wrong, he basically can't walk for a long time, like a day or two.
So planks are good if somebody's muscles are stronger, but doing small ab exercises are much better. So Kathy and I demonstrated one where you sit on the edge of the chair and you do breathing exercises. So by opening up your lungs, you're actually working your abdominal area as well. So I'm going to demonstrate it real quick since everybody can see me. As I sit on the edge of the chair, I take one deep breath in and go, and for 3 exhales. So 1 in, and
what if I pass out from breathing in too long and holding it too long?
Well, you don't want to do that, but we're usually pretty good at measuring our breaths and seeing how long we're able to do that. But usually 1 breath in and 3 breaths out helps to strengthen the abdominal area without putting stress on the body. So, and when we strengthen our abs, we help our lower back because it prevents us from leaning forward as much.
Wow, that's excellent. So do you help people with their exercise programs regularly?
I do. When we work with patients, we usually we see what's wrong with them, and then we give them specific exercises and stretches so they could take that home with them and help them recover and be successful in their physical activities.
And where are you located?
We're located right here in Palatine, right by the Palatine Public Library. We're in the medical building. So we're really close as an access to everybody. So
That's nice.
right across the street from you guys.
Yeah, it's about 2 minutes from Elderworks Center in Palatine. If you want to go and play with Julia, I'll just invite her over for coffee and say, hey, what should we do today?
Sure, not a problem.
Yeah, for me, I'd enjoy it. I don't see any other questions, so I'm going to let you go, but you are the best. Thank you so much for supporting the Expo and our seniors. It's most appreciated.
Thank you so much. Thank you for having me. I hope you guys have a continued and successful Expo.
I hope so too. I'm hoping people want to learn. Take care, Julia.
You too.
Bye.
And demand for senior services increases, Elderworks will be there, offering more learning opportunities, activities, fun, and support. Aging well and planning for future needs can be easy if you call Elderworks 847-462-0885. Mike Iwanicki is the superintendent for the Veterans Assistance Commission of McHenry County. Today, he's going to be talking about veterans benefits for home and senior living settings. Please welcome Mike.
Thank you, Jennifer. And I also want to thank Elderworks for inviting me here to speak on veterans benefits as it relates to senior benefits for senior living and home environments. That is a very broad topic because a lot of the things the VA does and provides would fall into this category. And there are some things that people may or may not know that have changed over the years. So, and I hope to be able to touch on a lot of that. So let's go right to our presentation. Share the screen and You should be getting ready to see that. And there we go. I gotta see my screen. Okay, I just want to start off with what is the Veterans Assistance Commission? The Veterans Assistance Commission is actually a commission of individuals who represent the various military service organizations within McHenry County. In our case, that would be the VFW, the American Legion, AMVETS, Polish Legion, etc. And when they all get together and decide to create a commission, they petition the county board to create a central benefits office. So we are actually a local unit of government. And that being said, that means the services we provide, whether it's advocacy before the VA or transportation to VA hospital or to client assistance, that's all free of charge. We do not charge for any of this. And most of the counties around the Chicago area do have a Veterans Assistance Commission. So if we're not available to help, we can get you in the right direction of who can help you in your area. So what we do is all VACs provide some kind of financial assistance. Our VAC also provides transportation, and we provide advocacy before the U.S. Department of Veterans Affairs. And it's a lot of what we're going to talk about today is what the U.S. Department of Veterans Affairs offers, but we are going to touch on some of the things we offer. Now, it doesn't matter how much we do if our clients can't contact us or can't get to us. And that's why back in 2005, we started direct client outreach. Now, direct client outreach, unfortunately, is restricted to McHenry County. That gives us the ability to visit veterans in their home, see them at, say, McDonald's or some other location, such as the library or township office. And these are for people that have problems getting to places because of either disability, work schedule, childcare, etc. In some cases, we've actually met with clients in the hospital and in nursing homes. Most of the time, people just didn't know we existed, and when they found out we existed, they didn't think there was anything we could do because they couldn't get to us. Now, when it comes to advocacy before the U.S. Department of Veterans Affairs, there are no borders. It is a federal accreditation that we receive, and with that federal accreditation, we don't discriminate based on where someone lives. So whether they live in Tennessee, McHenry County, or Wisconsin, we don't care. If you want to work with us to help you with your claim with the U.S. Department of Veterans Affairs, we're more than happy to do it. And with the advent of Zoom and other programs like Zoom, we can meet the clients face to face from remote, and we do that. So let me talk a little bit about Veterans Financial Assistance. Veterans Financial Assistance is mandated under Illinois state law. Any county that has a Veterans Assistance Commission, it does have a Veterans Assistance Program. And it is defined by the commission because the commission basically creates the programs under it based on the needs, the unique needs of the community they serve. Here in McHenry County, we help our lower income veterans with rent, mortgage, utilities, food, independent living services, which is a broad category. That's sometimes transportation, that's sometimes temporary living arrangements, that kind of thing. We also provide emergency assistance. Emergency assistance is different from veterans assistance in that it can only be granted to someone who doesn't qualify for regular veterans financial assistance. It's a little higher. It is not month to month, though. Currently it's every 2 years. We're looking at making that more frequent, but currently emergency assistance is only granted for utility bills or for arrears rent or mortgage. And then finally, we have disaster assistance. I'm not aware of any other BAC that has disaster assistance. What that does is if the house becomes unlivable through no fault of the veteran or the surviving spouse, then we're able to work with another agency to help put that person up in temporary lodging while the house is made livable again. This is a unique program in that it is in coordination with other agencies, such as the Red Cross, the McHenry County Housing Authority. And the most common reason that we provide disaster assistance is either flooding or fire more frequently. Not listed on here, but we're going to go right to it, is Caregiver Relief Veterans Assistance. Back in 2018, we provided a survey to many of the veterans in McHenry County. We sent it out to 4,000 veteran households and asked them for their feedback. What's missing? What should we be providing that we're not currently providing? And we got answers that were, at the time, I thought somewhat cryptic, but they were saying, you know, I use VA healthcare. They're very good at helping me, but, you know, I need to take care of my wife and there isn't much help for her. I took some of this stuff and I went to a couple of senior advocacy groups and found out exactly what I thought was going on. Was they were actually talking about caregiver assistance of some kind. And the big thing here is to provide some relief to the caregiver. And again, this is a program that's specific to McHenry County. And the type of assistance we're trying to provide to give the caregiver a break would be things like maybe adult daycare for a couple days, so the caregiver can get out and take care of their own business, like healthcare examinations, going to the beauty shop if they do such a thing, or just visiting friends and having some coffee or something. And housekeeping, you know, as some of our clients get older, you know, simple things like bending over to pick stuff up is becoming more and more difficult. And if this person needs the help, we can actually pay for, and they're eligible for caregiver relief, we can actually pay for a housekeeper to come out and give them a hand. So, you know, my own personal experience with caregiver was with my father-in-law and my mother-in-law. My mother-in-law had Alzheimer's disease, early onset dementia, and it became very challenging to take care of her. My wife and I were frequent helpers, but my father-in-law tended to turn those things down, and that is one of the things that I think is a problem with some caregivers. Even though I was aware of what was out there to help him out and shared that with him, he frequently felt responsible to be there. So when someone would come and provide assistance to help him out, he was often still in the house doing whatever, typically talking with the helper, and instead of leaving and taking care of all his own medical appointments or shopping or whatever else he needed to do. And that included a couple of times when my wife and I would step in and try to help out. Sometimes he'd be there too instead of taking a break. It was infrequent that we were there alone with mom helping take care of her while dad was out taking care of business. And that's very, very stressful on the caregiver. And that's what this program is for. And similar programs are for, to give relief to that caregiver. It's oftentimes they're thrown into this position and they have nowhere to turn. And we're a resource. Elderwerks is a resource. Senior Services and Senior Care Volunteer Network have resources that can help put that caregiver in the right direction. Now, eligibility for our program, the care recipient is either going to be an honorably discharged veteran or the surviving spouse of an honorably discharged veteran. We're not just looking at the veterans here, we're also looking at the veteran's family member. the caregiver can be taking care of the veteran, they could be taking care of the veteran's spouse, they could be taking care of both. And in some cases, we have veterans who are single who don't have anybody to help them out, and the veteran is his or her own caregiver, and we can provide a little help there. For us, when we're looking at income and assets, it has to be below the VA asset allowance for VA pension, which is currently $130,000. And as long as it's within the Caregiver Relief Veterans Assistance Guidelines, we're able to provide assistance up to 4 times a year, about every 3 months. One of the big things is we do need to evaluate the need by a recognized senior advocate. Currently, we use Senior Care Volunteer Network and Elderwerks, and they'll report back to us on what the actual needs are. Because sometimes the problem isn't the motivation of the caregiver to be that person to care for their loved ones. Sometimes the person they're caring for, the home environment may not be the best choice for them. Sometimes a higher level of assisted living or a senior care facility, a nursing home, is a better choice. And that would be for the safety and health of the individual receiving care. And that's why we get that evaluation done, just to make sure that we're doing what is in the best interest of the person receiving care as well as the caregiver. So another service we offer is transportation. We provide transportation to and from the Captain James A. Lovell Federal Healthcare Center. We are there Monday through Friday, every day. And we have 4 bus stops for those veterans who have transportation problems. We have sharing an agreement with Senior Care Volunteer Network and Senior Services and some of this township senior buses, and they can actually get our clients from their home to the bus stop and then back again. So we do specifically go to Captain James A. Lovell Federal Healthcare Center, but on occasion there is a need for us to go elsewhere. And that's on a case-by-case basis. So if we have a client that needs to go to Milwaukee for some specialized care, we can consider taking them over to Milwaukee, or sometimes there's another VA contractor that's not close by that they need to go to and save our transportation service. They can't get there. We consider this, and it's based on availability, on whether or not we can do it. So we encourage people to ask. Again, this is specifically for veterans who live within the boundaries of McHenry County. Advocacy, of course, does not fall under that category. And so persons who are in McHenry County who would benefit from this transportation program are encouraged to apply. Again, we've got our number up here, and you can give us a call, or if you know someone who would benefit from this, have them give us a call, and we'll send them out an application and get them on the bus schedule right away. Okay, now, I mentioned advocacy. I do want to make a special note about advocacy, and I'm going to shamelessly read this verbatim. Although anyone can assist a veteran with preparing a claim, only an accredited service organization rep or attorney may present the claim on the applicant's behalf. In addition to accredited service organization reps located at VA hospital and regional offices, local veteran service officers can be reached through the Illinois Department of Veterans Affairs and the Veterans Assistance Commission, and the service is at no charge. This is really important, and it's important to make sure that the person who is helping you with a claim, whether it's aid and attendance or service-connected disability or any other form that's going to the VA, that you're dealing with an accredited veteran service officer. That means we are trained and recognized by the U.S. Department of Veterans Affairs to do this. Our staff here at the Veterans Assistance Commission were all accredited, and we had to maintain that accreditation from year to year. Now, what do? You go to an office and you ask for their accreditation. Well, if the person doesn't know, then maybe they're not accredited. But if you want to find a list of accredited service officers, you can go to the VA's website, which I have listed on this slide. And if you search for an accredited service officer, it'll give you a list of the service officers based on search criteria that you put in. And I guarantee you will find my name there, and you will find the names of the people in my office as well. And I can't stress this enough. Elderwerks and the Veterans Assistance Commission back in May did a presentation about caregivers and programs to help out caregivers. And it was a week-long program, and it wrapped up with legal concerns associated with being a caregiver and taking care of an elderly or disabled parent. And among the board members on that on the panel, we had a representative from the Illinois Attorney General's office who stressed the importance of making sure the person you're working with when you're working with the VA is an accredited representative. And that was important enough in his mind to bring it up there as well. In fact, if you would like to see that particular presentation, it was during the month of the military caregiver, and that whole series was very excellent. And you can go to the Elderwerks website and look it up. And it was a very good presentation, and I think you'll get a lot out of it. Now, advocacy before the Department of Veterans Affairs. One of the things that often confuses people is they know the VA. This is the VA. But what they don't know is there is actually 3 different VAs under the VA. Everybody knows the health administration. Those are the doctors and the hospitals. And by far, that is the biggest piece of the U.S. Department of Veterans Affairs. Fewer people understand that there is also a Veterans Benefits Administration. They're the ones that take care of the benefits, such as VA disability, aid and attendance, adaptive housing, education benefits. Those all fall under Veterans Benefits Administration. And then the third piece is the Veterans Cemetery Administration. The interesting thing about this, as with any huge bureaucracy, these different arms of the VA don't really communicate well between each other. So a veteran may have a service-connected injury, and he uses VA healthcare, and that service-connected injury continues to get worse year after year, and the VA doctors all know about it. But until the veteran goes to the Veterans Benefits Administration and tells them, hey, my condition gotten a lot worse, they'll never know. Because the VA Benefits Administration, VA Health Administration don't talk to each other unless the veteran tells them to. And the veteran has to tell the Benefits Administration, not the Health Administration. Anyway, what I'll briefly be talking about is service-connected disability, veterans pension, and survivors pension. Often talked in that is the aid and attendance portion of that, adaptive housing, and then I'll talk about some of the things under VA healthcare, including assistance for caregivers. So jumping right into VA disability compensation. Disability compensation is granted to a service member who, in the course of his duties, developed a chronic condition, usually caused by injury or illness. This chronic condition is ongoing. It is not something like he caught the flu and got over it and now they're fine. That would be considered acute, not chronic. The VA is only looking at conditions caused by an event that caused a chronic condition. Now, when we're prosecuting claims on behalf of the veteran, there are 3 things that we need to show. The first and foremost, we need to have a current diagnosis of the chronic condition. So something 8 years old from a doctor. Hey, the doctor told me 8 years ago I had this condition. That's not good enough. We need to see something that's less than a year old, showing that this individual is suffering from a chronic condition. And I'm going to use an example that I use quite frequently on aircraft carriers. I was in the Navy. On aircraft carriers, they've got these little fire trucks, and I'm not talking like the big red fire trucks that you see coming out in your local community, but these are small fire trucks that maybe 3 feet tall, 4 feet tall. They're not very big, but they're there to help in case there's a fire on the deck. So let's say a sailor gets run over by that and gets his leg broken. Well, getting his leg broken would be considered an in-service incident, the actual breaking of his leg, and now it has to be repaired. So what you can expect from a broken bone like that is over time, either by favoring that particular leg or other problems associated with a specific type of injury, the veteran may develop chronic arthritis. Arthritis is a chronic condition. It typically doesn't improve with time. So maybe 10, 20 years later, the break caused him to develop chronic traumatic arthritis, and is causing him pain and limited motion in his leg as a result of that. Well, that pain and limited motion potentially can be service connected. If we can show a connection between getting run over by the deck fire truck and getting that leg broken and the current traumatic arthritis they're suffering from, we were able to prove that the VA is able to provide compensation similar to what you get from workers' comp. In fact, I've often said that VA disability compensation is similar to workman's comp for the military, because there is no workman's comp in the military unless you're disabled, retired. So in addition to the type of example I gave, there is a whole list of conditions that the VA automatically concedes, and these are called presumptive conditions. What this basically means is that there was something about the veteran's military service which it is presumed that if the veteran develops a condition, that it is definitely related to military service. Everybody's heard of Agent Orange. Agent Orange causes all kinds of problems. So if a veteran develops diabetes mellitus, adult onset diabetes, type 2 diabetes, that has been shown to be caused by Agent Orange. So if an in-country Vietnam veteran or a veteran who served off the coast of Vietnam during the period of combat comes into our office and says, I've got diabetes type 2. We know right away that chances are that the VA is going to concede that that was related to that service member's military service, and they will rate that condition without us having to prove a nexus or a connection between the in-service incident and the current chronic condition. One of the bigger ones that we stress anytime we do a presentation like this is ALS, Lou Gehrig's disease. Back in 2008, legislation was passed because there seemed to be a statistical anomaly showing that persons who served in the military were more likely to develop ALS than those who didn't. And it was a significant enough where they determined that if you served in the military any era and at any point in your life developed ALS, the VA was going to service connect it. Now the condition is the individual had to serve continuously for at least 90 active duty days. So if they serve 90 days and develop ALS, they'll automatically be awarded service connection for that ALS. They do have to apply for it. Now, why is that so important? Well, ALS ravages the body relatively quickly. And keep in mind, this reg wasn't established until 2008. So here we have a regulation that came in 2008. What about all the surviving spouses whose loved one passed from ALS prior to 2008? Well, on those conditions, there is another type of claim we can do, and that would be for the benefit of that veteran's surviving spouse. So if the veteran had died as a result of ALS, then we can go back and show that it was something that, had that regulation been in place, that he or she would have been service connected for it. Therefore, benefits should be awarded the surviving spouse. And we've done it a number of times. We've done it for World War II vets, Korean War vets, Vietnam vets, the current vets. If ALS attacks at any time, any era, and the veteran is no longer there, the surviving spouse can apply for benefits under that rule. Now, that would go for any of these. When you're looking at the Vietnam veterans, there is a whole list of things under Agent Orange. But one of the important ones under Agent Orange, in 2010, they added ischemic heart disease. Well, ischemic is a very fancy term, but basically it means blood and oxygen aren't getting to the heart. And that's typical of somebody who may have congestive heart failure or require bypass surgery, had a heart attack. Those individuals are eligible also to have this presumptive decision by the VA for service connection for their heart. But what happens prior to 2010, again, for the widow whose husband passed away from a heart attack prior to this regulation going into effect? Again, that surviving spouse can still apply for benefits that will help them out based on their husband or wife's service. Atomic veterans, same thing. Camp Lejeune is unique. In Camp Lejeune, they had contaminated water. There was quite a bit in the water, unfortunately. It wasn't far from the residences there. And those who lived at Camp Lejeune for at least 30 days between 1953 and 1987, if they develop certain conditions, it's going to be presumed to be been the result of the contaminated water at Camp Lejeune. But there's an added thing. Like I mentioned, this are at the residences. Well, many of those service members had their families with them who also lived at Camp Lejeune. And if any of those family members develop certain conditions, they would be eligible for health care as well. Now, on the Gulf War veterans, there is a number of issues in there. But as of the 1st of this month, August 2021, in case this is being recorded for later use, the VA had on August 1st announced 3 more presumptive conditions related to those who were in Southwest Asia and exposed to burn pits. And those would be rhinosinusitis, sinusitis, and asthma. And if a veteran develops that, and I know people from that era who have been trying to get service connection for that, well, guess what? Apply again, because now it is a presumptive condition. So when we're looking at these presumptive conditions, again, I can't tell you how important it is, because even if the veteran is no longer with us, if the veteran died of a presumptive condition, then their surviving spouse is eligible for benefits, and that can be a big help, especially if they're getting older or need some kind of in-home care. Now, let's go to something else the VA has, which is adaptive housing grants. These are specific for veterans who have severe disabilities, and most of them include something that's going to affect mobility. I talked about ALS earlier. Someone with ALS may likely be at some point eligible for specially adaptive housing. And what that does, that is a grant from the VA to modify or build a home that the veteran owns and make it so it's livable for them, give them the adaptations they need to be able to use that home. Again, that process can take a while, but it is very good. And another benefit from in most states, Illinois included, has a provision in the law that if the veteran has especially adaptive housing, the amount used for that can be written off on their property taxes for equalized assessed value. Not the whole value, but the equalized assessed value of that benefit can be written off on their taxes. And many times that basically means that the veteran is no longer paying property taxes. Another one that's available is special home adaptation. We saw under the current conflict we were in Southeast Asia, that in the Middle East, that some of our veterans are surviving really tough injuries, and they're coming home, but they don't have a wife, or they're coming home to their parents' house. Well, unless they own the house or their wife owns the house, they can't get specially adaptive housing. Well, a provision was made where special home adaptations can be made on the family member's house, such as the parents. So if that veteran is living with the parents, up to $20,000 plus can be used to make some modifications to make that home livable for that particular veteran. And in case the veteran is in transition, temporarily living someplace, they may also be eligible for benefits to modify the home while they're waiting for their own home to be completed. Okay. Now, veterans and survivors pension. I'd be very surprised if nobody heard about this. It has been on the news. It is talked about frequently. It is commonly called aid and attendance. Honestly, what it really is veterans pension or survivors pension. And there's actually 3 levels to it. There's regular housebound and aid and attendance. Aid and attendance being the highest level of benefit because that is the highest level of disability. So what is the pension? The pension can be awarded to individuals who served during the period of combat or wartime. They didn't have to serve in the theater, but they had to be in the military during that period of time. And for the survivors, that means that their veteran spouse actually served during that period of time. So what are the 3 levels? Well, the 3 levels: regular. Regular means that they are considered to be totally disabled or over the age of 65. Part of that I kind of thought was comical. I understand the totally disabled, but the VA is basically saying if you're 65 or older, you're totally disabled for pension purposes. So whatever. So then the other one is housebound. Those are people whose illnesses or injuries means they're pretty much confined to the house regularly. They may get out to the doctor, they may get out with somebody's help, but they're not basically getting around on their own. And aid and attendance means they absolutely require the assistance of another person to thrive. In any of these cases, the VA has changed the rules over the years. It used to be a person can take all their assets and put it into a trust on Tuesday and then apply for this benefit on Wednesday. That's no more. This is becoming more like Medicaid in that the VA now has a 3-year look back period, and they also have a penalty period, kind of like what Medicaid has. So they want to know, everything about your finances when you're looking at this. It's not unusual for us to see a 60-page application. Don't panic. A lot of those pages are blank, but the VA is trying to cover everything. So they want to know what your assets are, what your income is, and what your medical expenses are. So when they look at this, they're actually first seeing, does your income and assets, is it add up to less than the pension limit right now, pension asset limit, which is just over $130,000 now. And then they look at what your income is and whether or not that falls within the pension limits. So what do you get from all of this? Money. That's it. Unless you're the veteran, the surviving spouse just gets money. And the veteran gets money and VA healthcare. So if he's not already, or she's not already receiving VA healthcare, if they get the veteran's pension, then they're going to get it. So what they're looking for is the household's income. So if it's a veteran and the veteran's spouse, they're looking at both their income, both their assets, and except for the primary home. And then they take the medical expense, countable medical expenses, and it's both their medical expenses, not just the veteran. So if there's somebody else in the household, such as their spouse, it's their medical expenses as well. And health insurance is a medical expense. Dentistry is a medical expense. So those are often missed. So they take that and they deduct it from what their income is. And if the final number is below the pension limit, they bring them up to the pension limit. Now, what does that mean? Now, oftentimes when some of these organizations, not all of them are up and up, but some of them, they're talking about aid and attendance. They're giving you the maximum figure that someone can receive for aid and attendance. Well, the truth is, if you're qualified for pension, you may or may not get that maximum number. It depends what the final figure is. So let's say the pension amount for a veteran and the veteran's spouse is $1,500 a month. And after they determine the income less countable medical expenses, and they came out and said, well, they have $1,000 left over. If the pension limit is $1,500 and the veteran and this veteran's spouse together have $1,000 afterwards, then the VA is going to help them with $500 a month to make up the difference. And we've seen awards smaller than that. I think the smallest award where I see a monthly check is like $32. But in the case of the veteran, they're automatically enrolled in VA healthcare as well. We do these claims. We're more than happy to help anybody with this type of claim. The benefit of our doing this is we're not just going to be looking at pension. We're going to be looking at other programs that may be better than the pension for that family, especially if we find out they can be service connected. And in the case of the survivor, I think I mentioned earlier, there is a program in case the veteran passed away due to a service-related illness. The veteran did not already have to be service-connected or even known by the VA for the surviving spouse to receive this benefit. My ALS example, a Korean War veteran dies of ALS in 2000 just because that veteran never filed for benefits for ALS doesn't mean the surviving spouse can't come to our office and apply for this benefit, dependency and indemnity on behalf of herself because of her husband's death. So this is kind of, dependency and indemnity is kind of like an insurance policy against loss. So in this case, we had a presumptive condition that the veteran passed from. The VA is going to assume it was from military service, even though that veteran did not file for this. The spouse will likely be awarded DIC, and they'll get a monthly stipend and medical insurance. So let's say they're 65, they have Medicare Part B. Well, now you have your own supplemental with CHAMP VA. And in any case with that, I usually recommend that you check with your own insurance company and your providers and make sure CHAMP VA is a good fit. But that is an excellent, excellent benefit. And let's say the veteran is younger and he had a family and kids, and he passed away or she passed away from some condition. Well, the surviving spouse gets dependency and indemnity. The children are also going to get benefits from dependency and indemnity, including the insurance and education benefits. So this can be a big thing for some of our surviving spouses whose loved one passed away. Now, speaking of healthcare, the VA, their biggest program is VA healthcare. And some of the most of the questions we get from people is, how do I get in? I'm getting ready to retire. How do I get into VA healthcare? I was told by the VA that, or by the military, that if I served honorably, I'd be given VA healthcare for the rest of my life. Yeah, they promised me that too, but they changed the rules in the 90s. So how do you get into VA healthcare? Well, right now they have 8 categories, and you have to fall into one of those 8 categories to get healthcare, and specifically category 8, chances are you're not going to be able to get in. There are some places you may be able to receive healthcare depending on what hospital, but it really depends on funding and availability. So the people who are automatic, of course, are those who are service connected, have service-related disabilities that the VA is compensating them for. They get VA healthcare. Same with the veterans who are pension recipients. Now, certain military-related awards, if the veteran has a Purple Heart, guess what? They get VA healthcare. And exposures to certain environmental hazards. I mentioned Camp Lejeune water, but Vietnam veterans, those veterans who served in country Vietnam or off the coastal waters of Vietnam, should be able to get VA healthcare. Now, an important note on this, a lot of people say prior to 2010 applied for VA healthcare and were denied because their assets were overruled. After 2010, they changed the rules a little bit, and they no longer look at your assets. So they're only looking at income now. So I encourage those who have been previously denied when they applied for VA healthcare to apply again. And for those who don't have service-connected injuries, they're going to look at income, and they're going to look at it. If you fall below the poverty level, you're going to get it. You get it, all the services free of charge. If you fall under category 7, which means you're below the regional average income less medical expenses, then you're going to have care, but you're going to pay for prescription costs, which I believe is $9 for a 30-day supply of whatever, $51 for a specialist, and $15 for a primary care visit. And if you're in category 8 and there is an agreement for you to pay for all healthcare services, you're going to pay more. And on that one, I just say your mileage may vary. Now, in VA healthcare, they also have programs for the caregiver. The biggest one, which is for seriously disabled veterans, is the comprehensive caregiver assistance. And along with the comprehensive caregiver assistance, what's part of that is there's insurance for the caregiver. There is a monthly stipend that the VA pays the caregiver, and it's not bad. And you get travel and allowances, counseling for the caregiver, and respite care, which I always say, take advantage of the respite care. You need a break. Of course, there's certain rules that apply, but the most important thing is there must be a clinical need. So in addition to that 70% or better rating that That means the disability, there actually has to be a clinical need for that person to have a full-time caregiver. If there isn't a clinical need, it is not going to be granted. And this is something administered by the VA hospitals. So for those who aren't eligible for the comprehensive, there's also general caregiver support, and that provides education and training that's at the VA hospital, and it also access to some of the home and community-based services. I have on there a phone number, and that is for the VA caregiver support line. They can get you in touch with the local caregiver coordinator for more information if you think your veteran is eligible for this, or if you know a veteran you think is eligible for this. One of the catches is a veteran who gets this type of thing, who is eligible for this, must be a patient of the VA. If they're not a patient of the VA, they're not going to be eligible for this. Now, more that's offered by the VA healthcare is the home improvement and structural authorizations, or we call it the HISA grant. And again, this pays for medically necessary alterations to the home. Oh, you know what? I missed something. I'm going to go back a slide. One of the community-based things, if you're in the Cook County or some of the surrounding counties, there is something called the VIP program, which is the Veterans Independence Program. And that is extra monies that are available for in-home care for, again, clients of VA healthcare. So if the veteran doesn't have any of these other things, the VA primary care doctor may offer up to 16 hours or so of in-home assistance for that veteran. And 16 hours is, and that's 16 hours a week. And that is common, and we see that quite a bit. But it's administered by the VA, but it is actually a local program. And that may be available to veterans who live in the northeastern Illinois area. And going back to the HISA grant, the VA Health Administration can assist with getting some modifications, minor modifications to the house for certain service-connected injuries. Again, these have to be medically necessary. My favorite example is a veteran lives in a two-story home. The bathroom is on the second floor. They can't move very well anymore. So the VA authorizes a HISA grant to put in a chair lift. And then the veteran can get up and down. So if the veteran is service-connected, then even with non-service connected injuries, they can get this chair lift so they can get to the second floor. Now, if the veteran has non-service connected injuries, then that amount is less. Now, what's not included in this is ramps to get in the house. The VA will provide veterans with electric wheelchairs if they need them. But funding for a ramp comes from a different pocket, let's say. So the VA does do that. Your primary care doctor at the VA can prescribe a ramp, and the VA will go out and help you find a contractor, put it in. It is going to be done according to ADA, Americans with Disabilities Act standards. It is not going to be, we're going to fashion this so it blends right into your house. Chances are it's going to be aluminum. It's not going to blend at all. The important thing is it's functional and it's going to help the veteran get in and out of the house. And that's what the goal is for doing that. So the VA has funds for that as well. Now, we talked about the VA, we talked about the Veterans Assistance Commission. We aren't the only ones out there. We are one in a network of local social service agencies that are able to help. We specialize in veterans benefits, but we also know other people who do a very good job in what they specialize in. And sometimes the VA may not be the best choice for certain issues. And that's where we like to know who we're working with in the community. So referral service is very important. I don't know any agency that's one stop does it all, because we all specialize in something. So I frequently refer to Elderwerks, Senior Care Volunteer Network, Housing Authority, and other agencies to help families out. Because sometimes it's not the vet that needs help, it's their daughter, it's their wife, whoever, and we can help them get with the right people. So the way we provide assistance, sometimes it's giving referrals. Sometimes we'll get a phone call asking for financial assistance, but that person lives in Wisconsin. Well, we know some of the programs in Wisconsin, and we're able to help them get in touch with it. If it's advocating on behalf of the VA, we're happy to take care of it. If it's something we can't do, we're going to try to find someone close to you who can. And with that, I am open for questions. I do want to point out a couple important numbers in here. I gave you the VA caregiver support line on there, but the VAC, we are a member of the State Association of VACs, and that's their contact information. So if you're looking for a local VAC, you can call us, like that young man has tattooed on his arm, or you can go to the Veterans Benefits of Illinois .org website, and they have an interactive map that can show you where Veterans Benefit services are. Now, I am open for questions.
Hello, everybody. Let's see if Mike's here.
I'm here, Jennifer. I don't know if you caught that. Just a second. I got to get my camera set up again.
No worries. No worries. So thanks to everyone for joining our expo. I know that it's been a long week. It's only Wednesday. We have 2 more days of fantastic speakers and such. Hey, there he is. Hi, Mike.
Hi, coffee accident.
I had that the other day. I accidentally tipped over my coffee on my mouse. My mouse pad is not so pretty anymore, but c'est la vie. So Mike is the superintendent for the DMC of McHenry County. We refer to him often here at Elderwerks. I just actually gave someone your brochure on Monday, last Friday. I don't even remember. The days are running together. It's crazy here. I also want to thank Pam Evans for making some really nice comments. I don't know, I didn't announce it, but she said that we're awesome, so I'm happy. So I watched some of your presentation. Actually, I watched all your presentations all the time, but is there anything that you're seeing currently that is really prevalent in Northern Illinois with our veterans? Is there anything that's really common amongst our vets that you're seeing with issues?
I think some of the things we're seeing now is the news is just getting out, especially about what's going on with the Desert Storm veterans, and the fact that they're now recognizing some issues from the burn pits, as I mentioned. A lot of these guys had filed before, and they were not getting benefits. The VA was just denying them outright. Now they're coming back with it. The other big one, and you've heard me stress this a zillion times. I do it every time I do a presentation. You've got certain illnesses that chances are the veteran died before the VA recognized it.
Right.
And I stressed it here. I can stress it again. ALS. And I can't tell you the number of widows that we found who had no idea they could get anything from the VA because their husband died years ago.
Right.
And it turns out the VA changed a rule. Now that loved one is able to, now that spouse is able to get a benefit because of the VA recognizing that the death of their loved one was related to their military service.
So how would they find out about that? If they don't know about it, how are they going to find out about it?
Well, they come over to places like this and they learn about stuff. We do a lot of public presentations about it. We do sponsored content with our local newspaper. We're going to be starting doing YouTube videos where I'll get blasted out every day.
Very cool.
The posts know about it. The big thing is if a lot of times the surviving spouse, especially in those cases, their loved one died years ago and they're just out of touch. And the best that we can do to get the news out is attend events like this, make sure all the posts know about it, get people talking to each other. So it's one of those things where if you know somebody who passed away of one of these illnesses and they were in the military, what does it hurt? Let the spouse know, have them give us a call. We'll look into it for them.
Absolutely. 100% agree with that. I know that I've sent a lot of people to you to basically pick your brain to see if there are any benefits that would benefit the surviving spouse, because sometimes they're not so wealthy, right? They're living on fixed income and they need services, or they need to move to like an independent living situation or assisted living, and they can't afford it. And they should be able to afford it because their husbands or wives participated in the military. They did everything they could for our country and deserve every benefit that they've earned. Yep.
And I do want to point out the family from Arkansas. I talked to them yesterday.
Oh, good. So just so everybody knows, poor Mike, he never says no. So I send him everybody from all over the United States to help. And Mike doesn't say no because he's a true patriot and he believes that our veterans deserve the respect and dignity and the benefits they've earned. And they're non-transferable. Please, God, if you've earned it, get it. Our government's not going to say, oh yeah, we'll give it to you whenever you want. No, you need to apply. They're just going to not do anything otherwise.
Yeah, and to your note about some of the people who are lower income, the caregiver, assistance for the caregiver, that is such a big deal because I can't tell you how many times, even in my own family, I've seen the caregiver just surrender everything, their health, nutrition, just to take care of the other person.
Yeah.
And get in touch with somebody. If you know somebody who's in that position, get in touch with somebody, find resources for them. Even if they're not a vet,
Right.
reach out to them, let them know there are resources out there that can help.
Well, the thing that we get told all the time, I just had a walk-in today by a gentleman. He's like, I don't know who you are or what you do, but I saw a flyer in your window, so I was interested. He goes, and then I explained what we did. He goes, what? He goes, how would I know about you? Are there other places like this? I said, no, there's only one Elderwerks. The good news is there's more than one BAC, right? And you are an absolute treasure to any veteran and their family out there.
And there are other VACs in the state of Illinois. If you go across the country, there are veteran service officers. I can't stress again, make sure they're accredited if they're working with you. And we heard the Attorney General's office say that very same thing just a couple months ago.
There's some things that the government can do, and there's things the government can't do. And if someone is not actively committing fraud, but they're on the line, that's still, in my book, not ethical. So the key word is accredited. Okay, remember that. Mike's accredited. His team members are accredited. They're fabulous. They'll help you. But yeah, so is there any, did you talk about the Blue Water Navy at all?
Not really, because I was into the new, you had this new thing with the VA recognizing injuries caused by fire pits. And one thing I didn't hit in there because it got, because I got the question right away. I mean, as soon as I sent it out there to everybody, I got the question right away. What? Right. Vietnam veterans were never exposed to fire pits? I'm saying, give me a break. We've had fire pits since the Revolutionary War, if not before that. The big difference is what we're burning in those things.
Yeah.
There was some heavy metals that were burned in there. There's computer parts that are burned in there. And a lot of that stuff just is not really good for you. And since these studies have come out, my understanding is the military is making some changes about how they're disposing of these things. Ha, 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 ha. Let's see if that actually happens. as far as the Blue Water Navy vets, they were recently recognized. So they said if they served off the coast of Vietnam and they made the coast equal to the demarcation point. Well, the demarcation point is as far as 75 miles off the coast of Vietnam. So we have had carrier sailors end up being eligible for benefits related to Agent Orange exposure. And one of the big problems that those Blue Water Navy guys had is the runoff from the coast would get out there. The evaporators would pick up the water, and that's how they made fresh water on the ship. They evaporated it out. Well, apparently the evaporators didn't do a good job of getting the contaminants from Agent Orange out of there. So they may have been showering or drinking it.
That's not so good.
No, it isn't. I'm waiting to see the firm science on that. I first read about that from something that Australian sailors were looking into, about whether or not the evaporators were effective at taking that stuff out. So all the things that people who are exposed to Agent Orange are presumed service connected for now, including more recently bladder cancer, Parkinson's-like syndrome, and hypothyroidism, which were recently added. Blue Water Navy sailors may be eligible for those as well.
They should be. And I don't know why we don't take care of our military and our people better. They're important. They're important, and we need to respect that they're important. I don't understand why we would ever put ourselves in that kind of position.
Well, going to war is tough, and there's definitely a cost. And just serving in the military, I probably said this before too, in the work field, in the civilian work field, you've got OSHA and other agencies that are there to make sure that you're working in a safe environment.
Right.
I don't remember any time I've ever seen an OSHA inspector out on the battlefield.
No, probably not.
Outside of while they were building the ship, I don't think there was a single one during the day-to-day operation of the ship. The equipment is dangerous, and it is built for mission effectiveness, not for our personal comfort.
Right. It's unfortunate, though, that there's some repercussions from that, and it's affecting them long-term, which is a problem. So.
Absolutely.
Well, I'm glad the VA is recognizing it, and I'm glad that our veterans and military, anybody who really needs help, can contact you, Mike, and your team, because you're a valuable resource, and we appreciate everything you do here at Elderwerks.
And I appreciate, I got to talk to that guy yesterday. There are contractors out there that can install some of the stuff I talked about over at the VA hospital when they do the HISA grants. Oftentimes they ask you, the veteran, to go out and get a contractor. There are contractors in the area. It was pleasant communicating with one yesterday. Great presentation by him, by the way. Are you recording these so people can go back and see them?
Mm-hmm.
Oh, good. Yeah, he had a lot of good things to say. I can't wait to talk to him again.
Good. Well, thank you very much. We're going to go ahead and let you go. And if anybody needs Mike Iwanicki, he's with the McHenry County VAC, Veterans Assistance Commission. If you don't have his information, you can get it through Elderwerks. We'll be happy to give you his number. Thank you so much, Mike.
And thank you Elderwerks for doing this.
Of course. Take care.
Bye-bye.
Bye.
Hi, I'm Dave.
And I'm Joe.
And we are the suburban team of Mark Allen Realty,
the preferred real estate partner of Elderwerks,
and making real estate simple for transitioning seniors.
Chris Petrick is a nurse and a training specialist at Elderwerks.
Chris will provide participants with a variety of brain exercises to strengthen the brain's memory center.
She will discuss the tenets of healthy living and provide tips to help you improve your memory.
There are prizes for the winners, so participate in this fun game.
Elderwerks Educational Services is a not-for-profit 501c3 organization providing senior living coordination, advocacy, and education to. In many instances, our consultants serve as a lifeline or personal confidant to older adults who literally have no one living nearby. Elderwerks prefers senior housing options and providers based on you and your needs. What did you used to do? What do you do now? And what do you want to continue doing? We provide complimentary referral services to vetted supportive care providers and help families and acquaintances secure personalized living and benefit information. Our consultants are experts in senior housing of all types. We have toured the senior communities in Illinois, documenting the services, amenities, and quality of care to ensure seniors transition to the best options based on their individual. People view aging much differently than those of previous generations. Our seniors want to be connected, relevant, and celebrate life in active, vibrant surroundings. We've helped thousands of clients secure and maintain a quality of life that suits their personalities. As the population ages and demand for senior services increases, Elderwerks will be there, offering more learning opportunities, activities, fun, and support. Aging well and planning for future needs can be easy if you call Elderwerks 847-462-0885.